bioinformatics and drug design. She is a member of many international affiliations and has authored many research articles and books related to biophysics. She has been awarded with the Department of Atomic Energy Fellowship in 1986 and became a research associate of CSIR in the year 1991. I kindly request ma'am to introduce our speaker, Professor Prabhakar Dongre, to the audience. Thank you.
Thank you. I think I'm loud and clear. So Professor Prabhakar Dongre is a professor of biophysics in the University of Mumbai. He's done both his MSc and PhD in biophysics. His research interests in nanoparticle-based targeted drug delivery and nanostructure-based snake venom inhibitor design. He has digitized several compounds of radiosensitizers and radioprotectors. He has published more than 60 papers and has 6 Indian patents. He is a reviewer of several journals. He has successfully guided 10 PhD students and 3 postdoctoral students. He has made immense contribution to University of Mumbai, especially to the Department of Biophysics, and he has also started a startup which is Sinova Labs LLP, which is I think for resource mobilization. So he has a proven track record in resource mobilization and fundraising, so I think we know whom to contact now for that. So I welcome Dr. Prabhakar Dongre to deliver his talk.
Good morning to all. Thank you very much, madam, for nice introduction. And at the outset, I would thank the organizer for inviting me this beautiful conference. So my talk would be on biophysical approach, preparation and characterization of nanomaterial, and specifically for the targeted delivery. In my talk, I am going to. So this talk would be on what is the targeted delivery and how we can design the vehicles, specifically using some proteins and nanomaterial, and how do we characterize this material using some biophysical techniques, and how it can be qualified for the drug delivery vehicle. So this will be my talk. And again, specifically at the end, I am going to briefly explain biodistribution of this drug, whether this vehicle can distribute the target site or not. We did a small experiment in the last month that is interesting. So I hope you will know the delivery system, which is the importance of the delivery system. So there are some common methods for delivery like mouth, skin, nasal, buccal, sublingual, ocular, rectal, any of those. That's how the common drug delivery route. But some of the components cannot deliver through the that I explained. But these drugs can be introduced by a special pathway, that is intravenous, and most of the antibodies, protein, peptides, they cannot take oral route or other route, but especially intravenous, because if this component take oral route or other way, they can degradation, they change the efficiency, therefore special route for this component. Then why do we need delivery? Specifically, I am to target delivery. The conventional doses from the provider immediately need causes fluctuation in level in blood, but so to remain the drug concentration in system, so we require for this target delivery. So what are the advantages of the delivery? So decrease dose frequency, reduce the rate of rising drug concentration, sustain and consistent blood level within a therapeutic window, enhance bioavailability to achieve target release, reduce side effects, improve patient compliance, optimum dose at right time and right location, efficient use of expensive drug excess, reduction in the production cost. So these are some of the important benefits and significance of the target delivery. So while designing the delivery vehicle, we must take care of this. Specifically, we are using nanomaterial. So we must understand this target, where the target of your site. One must know how the drug release, the kinetics of the release is important to understand while designing the vehicle. Route, again we must understand which kind of route we utilize. The property is also important while designing the drug vehicle. Biocompatibility is important. Sometimes in the toxic or not toxic, we take care about biocompatibility. Delivery duration and nature of the material. So these are some of the components that we consider while designing the drug vehicle. Now there are many of the drug vehicles available in market. That these are nanosomes, liposomes, nanoparticles, nanosphere, microsphere, microparticles, microemulsion, nanosuppression, etc. But here I am focusing on only nanomaterial, nanoparticle, how this nanomaterial can be used as a drug delivery vehicle. So then why do we need biophysical techniques? Because these techniques give a quantitative and deeper understanding of biological material. That is the novelty of this technique. It also provides qualitative solution for complex problems in biology. It provides opportunity to develop modeling and biological system, and physicochemical characterization of biological material provide a perfect solution before the design of clinical material. So this is a very novelty of the biophysical technique. Then what are the strategies we have adopted for the designing the vehicle? So we synthesizing nanomaterial for our own laboratory. We have developed this method for synthesizing nanomaterial. We also have facility for how to characterize this nanomaterial, specifically in biophysical techniques. Also, we are taking care of this particle, how it can functionalize. Because naked particle is not functionalized, but we have to functionalize it by coating biological material, antibodies, protein, or so on things, so it will functionalize accordingly for work. And mainly focusing, our laboratory focusing on silver, gold, and zinc nanomaterials. So mainly we are focused on three materials. So these are some techniques using for designing the vehicle. Mainly the fluorescence spectrophotometer, UV visible, dynamic light scattering, receptor dichorism, the Raman spectrophotometer, FTL process, and TEM. But now I am presenting only this data of the fluorescence, visible, and DLS CD. We are not present data here because there are huge data. It's difficult to present in this 30 minutes. So just mainly I am focusing the DLS and fluorescence and visible. So this is the flow chart of while we are designing the vehicle. So we must have particles, then synthesize the particle as a gold do. They have to characterize using various techniques, that is fluorescence, spectroscopy or imaging techniques, and then we have to prepare this complex. Specifically here we are using albumin, that is Boyle's albumin and HSA, Boyle's albumin for this vehicle. So we have again this electric interaction with particles and then we characterize all these things, all this spectroscopy technique. Once these techniques we were to prove, then can be used for the drug loading and understanding this localization. These are the flow chart of work. Fluorescence is very important technique. I hope you all know the principle of fluorescence. When you excite the molecules of gold, the substrate, and the ground state, when you come ground state with light, and that light is very important for the you can characterize light. I think this characterization of light gives the idea of what unity is. I will not go detail of this technique. Again, this is a very well known Japanese diagram which actually gives the real time characteristic of light. So again, I will not explain here. So this is a simple method of preparation of nanomaterial. Here is the chemical method we are using for preparation. Just addition of this as a source of gold and silver once the color appears specific for the solution, it confirms the formation of nanomaterial. And here I have an example of gold and silver. So the yellow and this light is indicated the formation of particle. Once the color will appear in the solution, immediately you can take it from the just PMU method, whether this particle form or not. Individual practice is most important techniques that the idea of the formation of nanoparticle. If you scan the solution of gold and silver, you will get the pick for the, as for example, silver, 420 and 520. So this pick indicates the formation of gold particle, gold and silver particle. And again one can go for diagonal scattering. The diagonal scatter is specifically for the size of material, distribution of size of the area. So from this experiment we got near about 60 and 30 nanometers silver particle. Now again one can go for this, what type of the shape of material of your, so this HRT or TM, this idea about what type of shape of it, because shape also is very important for the interaction of the biological material. So this is the circuit of shape, the images of it. Now, then how this material interact with the protein molecules? So for example, what is albumin? So this indicates that when incubating the albumin, BSA in any concentration of nanomaterial, so indicate the first spectra, indicate that fluorescence spectra decreases with increasing concentration. This decreasing concentration is known as quenching. The fluorescent quenching takes place. So fluorescent quenching varies the concentration of your nanomaterial. Decreasing fluorescence. So this happen in both similar result. Human cell albumin and HSA, PSA, bone cell albumin. Now, this can be very beautifully characterized using biological communication. Very important. This mathematical model we can characterize systematically. Your fluorophore and material. So here is a nanomaterial and a protein. So it is we can calculate, understand by the thermal equation. So this is if you plot the graph of the response fluorescence against the material, so this kind of you get graph, and so this shows that if there is a straight line, indicate that there is a static interaction. If there is a curvature in your graphical representation, it shows that there is a dynamic quenching. So this in our case, the silver particle, when silver interacting with the protein, it's showing the dynamic interaction. But if you understand in case of gold particle, it is static interaction. So this result indicates that the gold having different interaction, silver also different interaction. Silver having both kind of static dynamics. And this can be studied by this. This is this Sturm just I told you, Sturm equation is a very important mathematical equation that ideas of static and dynamic quenching. So this we can see. So this constant PSV is there is a changing with temperature indicate the dynamic, but this in case of this PSV won't change. This constant indicate static constant. This is a very important. You can get information on this equation. Now, it is possible to understand from this process that how many bindings are available for this material. So again we need to do this equation that we have to plot this fluorescence on the thing. But it is possible to calculate the amount of bindings of the protein. So less than 0 or delta S is more than less than 0, it is a hydrogen interaction. If delta S is less than 0 and delta S is less than 0, you will get van der Waals hydrogen interaction. If delta H is less than 0, it is more than 0, so it is zero. So this less than or more than 0 of value will indicate good ideas about the kind of interaction, whether it is van der Waals interaction or whether it is a hydrophobic or filtering interaction. Now this, after estimation of the value of this interaction of gold, silver with the protein, to indicate that this albumin has a van der Waals hydrogen bond interaction because negative value indicates. Similarly, so this silver nanoparticle and BSA is a hydrogen interaction. So these values indicate that what kind of interaction takes place between the nanomaterial and protein. So here is the mechanism that van der Waals hydrogen involved in the interaction. So this is the mechanism we roll out. Now, this is another phenomenon we can study using fluorescence, that resonance scattering. If you scan excitation emission wavelength continuously, because in fluorescence there is a specific probe. If you simultaneously scan excitation and emission wavelength, so you get a typical signal, and this typical signal will idea about the kind of interaction with two material, fluorophore or here is the protein and the nanomaterial. So this, when if you scan simultaneously HHC and BSA, there is no signal. But in case of nanomaterial, there is a strong signal. This strong again indicates that there is an aggregation on protein and material. So this is again information from fluorescence. Now based on observation, we are able to construct some model whether actually the location of the particle, where it actually happened because of some observation from fluorescence, to indicate that silver nanoparticle is very close to tryptophan. Tryptophan is a very important combination using the fluorescence, and this one we can understand. So indicate that these two materials are very close to tryptophan. If the protein absorb on the nanomaterial, it indicates that this is close to the tryptophan. So this is all the observation based on the process in a fraction acceleration. Now, again we move whether there is a change in the second structure of protein when the nanomaterial interact with protein. So this I hope you know the CD is a very important device, the ideas about the structural aspect. So after this is the signature of beta alpha helix and antibody, standard signature of protein. Now, when we study the interaction of this nanomaterial with the albumin, the BSA and HSA, again there is a change in the second structure. So you can see changes. So in case of silver nanoparticle, there is velocity changes 45% to 35%. So this is a change in different concentration. However, there is no change in structure in case of when you have a gold nanoparticle. Indicate that interaction of gold nanoparticle and silver different. So there is no change in the second structure. Now, this is again one of the important phenomena takes place in when nanomaterial incubated the protein by the environment. Most of the protein absorb on the nanomaterial, and if there, for example, serum protein, if you put a serum protein, there is a competition takes place. Means there is affinity of protein takes place. Initially, small proteins interact, and later on, time advance, later on, so again this small protein reduce and only high affinity protein absorb protein. So this happens. This phenomenon is protein corona. So corona formation usually absorption of protein, specifically tight binding protein. Those protein high affinity particle. So this corona two types, hard and soft corona. Hard corona means the protein tightly bound to the particle, and soft corona means both protein tightly bound as well as a loosely bound protein also takes place. So those is known as a soft and hard corona, and this corona giving us opposite to the drug delivery system. So this is a typical representation of the hard and soft corona. The tight protein, the protein high tight to the particle is hard corona, and some of the loose protein present on outside. So this is a soft corona. Now this I told you, this is again like approximate to the drug delivery system, because it is possible to upload the drug on this protein, those protein binding the drug. It is possible to upload the drug, and once you upload the drug, it is possible to this albumin has receptors on the cell membrane, and definitely this receptor can interact with the albumin, your protein, and maybe deliver the internalized text. This is the strategy, the possible strategy of the if you load the drug. Now, again, how do we characterize the protein corona? So dynamic light scattering is a very wonderful technique. Gives idea of the amount of protein absorbed on the particle, and this specifically we are studying by this hydrodynamic diameter of your sample. So hydrodynamic diameter sample increases with your nickel particle indicates the formation of absorption of protein on nanomaterial. So this H, the H can be calculated by this way. So this is, I hope you know the principle of the dynamic scattering. I will not explain here. Then, how to prepare the hard and soft corona specifically for the loading? It is a very simple method. If you put the protein into put a particle into the solution, the naturally some absorb on the nanomaterial. I will simplify it nearly about 8,000 RPM for 10-15 minutes. The loosely bound proteins get removed from by centrifugation and tight over present, which is hard corona. And simply, if you want to prepare the soft corona, just remove, you can arrange the material to soft corona. So this is a simple method of preparation of hard and soft corona. Now, how do we practice hard and soft corona using fluorescence technique? You see that if you add the protein very consider nanomaterial, so fluorescence changes fluorescence intensity. So changing fluorescence intensity indicates that there is again binding of protein on nanomaterial. So while changing the fluorescence intensity, there is a little shift, blue shift, and also red shift. Initially there is a blue shift, means initially blue shift, and later on red shift. So red shift and blue shift is due to the some interaction and maybe some hydrophilic interaction. So this happened. Now again, one can understand the dynamic scattering. So if you add a protein on nanomaterial, go on adding. So what happens? So this addition, just like the attraction of the protein against nanomaterial, this will that. So DLS, if you add more and more protein absorption on protein, and here is a optimum absorption. Here is a maximum scattering of light. So indicate that this is the optimum protein, maximum protein absorbed on the nanomaterial. So this is the very wonderful technique. Gives idea of the amount of absorption. Now, again, when we move to whether this protein corona changes the second structure or not, again we have measured the helicity of this soft and hard corona. So it again indicate that there is a little decrease of the alpha helicity in both soft corona as well as hard corona. So hard corona is maximum changes as compared to this soft corona. So this is the change in helicity when you add the protein nanoparticle. Now we have checked. Actually, I checked a lot of functional properties of protein, but I am not presenting here. Only, yes, I am presenting here only whether this component toxic or not, whether it is biocompatible or not. So we carried out simple test hemolysis. So if you check the hard and soft corona, so there is a mostly this is a biocompatible material. It is not harmful to the viral system. And if only nanoparticle, there is an hemolysis. So this is a simple test of a biocompatibility. Now, so as I told you, this hard and soft corona give us upper soft and hard corona incubated with the drug and analyzed in again fluorescence technique. And it is possible to get the number of binding site for the drug on that corona or not. So here, this is the soft and hard corona. So there is a number of binding sites. दिखता है नीचे का curcumin bind to the both soft and hard corona, and it should be again vehicle for targets. Again this hard corona. So this is the again varying ratio of albumin and non-particle. So again, when you change the ratio, there is a binding site for protein for the particular drug. Now another protein which this is alpha and lactoglobin. Actually, we know in Indian we use the haldi and milk, specifically many diseases like fever or cold like that. This is our traditional medicine. So we thought that definitely there may be some vehicle for the carrying this curcumin. So we went through the literature survey and found that yes, there are some proteins in milk, specifically alpha and lactoglobin, and these two are well characterized in different ways. Therefore, we choose this two protein, whether this protein has able to binding curcumin or not, and we actually isolate the protein from the milk and we characterize and confirm using various techniques, AMS and all these things, and found that we with these two protein alpha and lactoglobin. Again, we studied this protein interaction with curcumin or not. Then the fluorescent data indicate that. So again, there is a binding site for curcumin for both alpha and lactoglobin. Similarly, we studied the gemcitabine, whether gemcitabine bind with this protein or not. Actually, this protein may express in the breast tissues, specifically lacto formation, and therefore we thought that this could be, if you develop this kind of vehicle, definitely it could more absorb this protein in the breast cancer, so in the breast tissue. So therefore we studied this. Again, this is indicate that there is a binding site for the curcumin as well as gemcitabine. So this again is a vehicle for this two. Now again, after binding the drug to the hard soft corona, then how it internalize in the cell, we thought that specifically the albumin has affect to the GP60, glycoprotein 60, GP60, and GP60 has on some of the receptor site, specifically this N-acyl numeric acid, L-glucose, acetylglucosamine, D-mannose, and D-glucose. These are some of the component. This is a material is present on GP60, that glycoprotein. Then we thought that can we study interaction of all these sugars of GP60 interaction with our vehicle which are established. Then so we again choose this 5 component for interaction of our vehicle, this GP60 receptor. This is actually the mechanism of how internalization takes place. So this is actually this is a protein corona with the drug. So it's surface GP60, and this is by receptor mediated endocyte takes place. And this is I hope you already know. And this is the way which enter in the site cell. So now this is a well established mechanism. Now again we studied whether your albumin with particle can bind with all these sugars or not. Again, with this the fluorescent data, a lot of experiment data, again shows that BSA or HSA has a binding site, and we still binding site. To the binding site varies from sugars. Some have 2, 1 like that. So again, but this confirm that there is a binding site for the sugars for the albumin. So again, this is the way, this is the mechanism. No. So I will show. So this is again the stability. So again, DLS, zeta potential, giving the ideas about whether your complex stable or not. So value indicate that plus 30 minus 30 millivolt shows that your complex viable and complex is stable. So sugars with all albumin is stable. This value shows there is a stable complex. Now again, this is this is again. So this is cisplatin and gemcitabine. Again, we loaded cisplatin gemcitabine on albumin gold particle complex and studied with all sugars. So these all sugars, those were selected as GP6 sugar, again indicate that there is a binding site for all material. So this confirm it is possible to this possible to load this load on drug load on this material, that is protein corona, because the binding all are binding site. This is again cisplatin with conjugate with the but also one person this have n number of binding sites indicate that there is a binding site, but yet there is variation in all sugars. So mannose, fucose has little bit low affinity, but high affinity to these other things. So this is again. Now again this is again a small biochemical test whether there is a agglutation index or not blood. But again with this complex induced in the blood, so there is agglutation. So again it indicates that there is it is safe for biocompatible. The hemolysis is also indicate that there is hemolysis by this component. This is again acetaxial interaction with this protein corona. Again this is again binding acetaxial again BSA glycans DPC receptor. So this is again. So this I will now how do this? So now we studied this binding with all the binding of protein, non-particle binding of the non-particle, intangible receptor. Then whether this complex distributed or not, that we have to understand. So we use this is again we labeled the technetium isotopes to this complex. First we tested whether technetium is very lifetime is 36 hours in isotopes, and this work we did in Mumbai, TMC Mumbai, and we standardized whether this complex binding types or not. But we found that basically experiment it is again if you get efficiency above 95% efficiency, this counts relation count. If 95% indicate that there is a binding, so we confirm that the technetium binding with the protein. Now we take a simple model whether this complex enter in the organs or not. So we just a very simple model, that is eggs. This chicken egg embryo we are taken after 18 days. Most of the organs appear. So this is the simple experiment, and this is open after 18 days. It a lot of vessel can see, and then you can use your sample. So this is just a test yet if this CT scan whether EPG enter not. This is just test. So indicate that. Similarly, again this is a PET scan or this is just a control test. Now we introduce this complex in the embryos and we remove all the organs, specifically heart, liver, stomach and head region. These 4 organs are removed from the embryo, and we check the count of the isotopes. So indicate that we count the counts in our heart, liver, stomach and head region. This is the weight of the organ and this is number of counts. So this indicates that your complex enter in the site. So this is a complex because this is radiation counting. So this was my presentation. Now, so based on our result, it concluded that nanoparticle protein corona could be qualified for the in vivo testing in a preclinical experiment model, and PSHSA or nanoglycans showed stable complex and strong binding capacity for each other. So chicken egg embryo experiment, the video labeling showed distribution of protein corona in various organs. So biophysical techniques allow to quantitative understanding of protein interaction as well as the designing of the carrier. And biophysical methods such as fluorescence and scattering, Raman, are compound early drug discovery process. So with this group we are working, and we work from various agencies, DST, DRDO, DBT, and DST faculty, and all my students. So thank you very much for this. Thank you.
Thank you, Dr. Bhumre, for a very interesting talk. Any questions? Can I ask this question? You spoke spoke about hard and soft corona.
Yes.
So are the binding properties of these two different to proteins? Yes.
I could understand.
You spoke about two types of nanoparticles when you were
Yeah,
talking.
yeah.
One was hard corona and the other was
Soft corona.
So are the binding properties of these two corona?
No, there is no binding properties. Slight variation. The observation is slight variation because hard corona more modification of the protein, soft corona less modification of protein. So there is like, but actually value of this not much variation. All having more than one binding sites. Binding more than value of more than one binding site.
And when you showed that slide, you showed that protein was binding more and more to it. That was one slide.
Protein.
So you have your nanoparticle in the middle, and you are showing that protein
Yes,
is
yes,
binding
yes,
on the
yes.
circumference of it,
Yeah.
and you are showing that with time more and more protein.
Yeah.
So are the number of sites increasing, or they are binding with each other? The protein is binding with each
Actually,
other.
yes,
Protein
yes.
interaction.
Just like this DL result, if you titrate the protein against nanomaterial, protein start accumulate on the material as increasing the concentration, and that we have measured DLS. And so there is an optimum. Once the accumulation affinity is certain up to certain level, when we have more and more protein, so that could not interact. So the loosely bound may not interact. Therefore, you get a scattering pattern up to particular binding.
Thank you for the wonderful talk and enlightening us on these biophysical approaches for the targeted drug delivery. So I have one small question from your talk. So is there any prescribed range of the thermodynamic properties for the electrostatic van der Waals force interactions or the hydrogen bonding interactions for the nanoparticles that you have mentioned for the targeted drug delivery? Since the nanoparticles have to be designed of various particle sizes depending on the organ where it has to be delivered. So is there any prescribed van der Waals interactions, the equations you have shown over there?
I think negative values indicate that is your this negative values. We have tried to understand what kind of interaction.
Could these binding interactions impact the nanoparticle drug delivery on that? This was my question. Just for the range aspect. Since you have shown the equation as well, so sometimes there is some scale that this nanoparticle range nanoparticle has to design, and this range of binding interaction should be minimum for the achieving that criteria. This is one question on general aspect only.
What is I have not reached that extent. Whether what is the range should be there? I have not reached that extent.
Thank you so much. One last question. You have chosen this chicken egg embryo. So other than that, what animal models we can choose to achieve these target deliveries?
Yes, this is a simple experiment. We just tested. Actually, we are going for animal model, but this is we thought we should just see what happened in the chicken egg embryo. It's a very simple model. One can introduce it. Is easy to maintain. One can introduce and can check. It's simple, but we are going animal model now.
Thank you so much.
I had a question.
Yes.
Thank you. That was a very elegant study. Actually, I arrived late, so I might have missed some portions. So I just wanted a clarification. You said that you have done your biodistribution with technetium-99m, and then you showed the PET results. So I just wanted to know that you again labeled it with FDG glucose.
No, this FDG
For the embryo study, so that you might have told at the beginning. I just missed it.
Embryo just got a control experiment. All for our satisfaction. Whether we are doing proper or not.
No, but the molecule did you
Getting FDG?
Yeah, did you label it with FDG?
No, that's a blame.
Okay.
Just we counts. We introduce the material as a label, but we are not taking cities. We take PET scan.
Because that's a gamma, that's a positron.
So we introduce and we actually ask the organs and check the count.
Okay.
So we have four organs and a count. The count indicates that because we have the complex level, because we develop the isotopes and the protein complex is stable complex because it is 95%. And then from introducing the embryo and remove the organs and found that there is a count.
Okay. So
count
this
indicates that there is a reach.
this is basically a counter.
Counter. Yes.
Thank you so much.
Thank you, Professor Dogre. It was really indeed a very enlightening talk on biophysical characterization. I just wanted to know you were talking about the soft corona and hard corona and the different types of interactions that are there. So would it make any difference to the biological application point of view? Whether there is a soft corona that is filled with your nanoparticle and there is a hard corona. So when we use these for biological applications,
any sensor can be established. I think sensing is possible. You can upload antibodies or some other material or protein. Maybe sensing. I am not going to create example, but sensing is possible. Sensor can be.
Thank you, sir. I think there's one more question.
Excuse me, sir. Sir, I just want to ask, does the body temperature affect the binding site of albumin and nanoprotein?
No, we have to be normal temperature. There is no change in binding site.
For nanoparticle drug delivery. Now I kindly request our chair to present a token of our appreciation to Professor Dogre.
Sorry. I'm so sorry.
Wait. One more.
Thank you so much, sir. I will request the chair to kindly introduce the second speaker, Professor Chandradeep Tandon.
Dr. Tandon is currently Dean Faculty of Sciences, Amity University, Punjab, Mohali. He was earlier Professor and Director of Amity Institute of Biotechnology and Dean Faculty in Biosciences and Biotechnology, Amity University, Noida. He is a PhD from Punjab University itself. That's a great thing. He's done his postdoctoral studies from University of Kansas Medical Center. And his research area is molecular mechanisms involved in the pathogenesis of kidney stone formation using proteomics approaches, development of an anti-dithyrambic drug which is plant-based, regulation and dynamics of metabolic pathways of high-value endangered medicinally important plants. He has several government-funded extramural projects from DBT, ICMR, DST, CCRA, and a Center of Excellence from DBT. He has guided 12 PhD students, he has 4 patents, and he is in several task forces and expert committees. So we welcome him to deliver his talk.
Thank you, ma'am. Respected Chair, all faculty members, dear students, and my dear friends. Well, as Professor Kaur already pointed out, I did my PhD in the field of biochemistry in 1998 from this university, which is my alma mater. It's always a pleasure to be amongst my own place, my own home. I can see lots of people whom I recognize very well. Dr. Ashwini Paul, he's more like a friend, and Dr. Rajesh Kher, he was my senior in biophysics, and me, and of course, my PhD student, Dr. Pranjeet, who is faculty member here. She was my second PhD student. First being Dr. I always remember my first PhD student, who also happens to be her husband, Dr. Rakesh Vijaria, who is now a big, business fellow, big man. Okay, with this, I start. This is my title. I've been working in the field of human gases, natural gases since last 25 years now. I've already successfully implemented around 9 projects, and one is ongoing in this field. Urothiasis, which is kidney stones in simple language. I'll try to make it very simple and very crisp.
and I try my best not to overshoot the time. It is one of the most painful ailments. It is the third most common affection of urinary tract after BPH and UTI. It affects 2 to 20% population worldwide. I am audible enough? There are reports that with the expected elevation in the temperature as a result of global warming, an increase of 1.6 to 2.2 million lifetime cases of kidney stones by 2050 might be rare. Hopefully, we pray to God it shouldn't be. This is about kidney stones. Till it is till kidney stone is lodged in the kidney, one doesn't feel any pain. The moment it starts traveling down the ureter into the urinary bladder, you can see the dimension of ureter. If it goes beyond 5 mm, it has to be surgically removed. And why I am saying so, because I have been doing my funded projects with Professor S.K. Singh, who is the surgeon. He recently retired from BJME with RTBT. I have been getting kidney stone from him. And if the size goes beyond 5 mm, it has to be removed surgically by extracorporeal shock wave lithotripsy or by nephrolithotomy or ureteroscopy. So we thought, let's do some research on it and try to see what all is there. And you can see, I have pointed out here the stone belt occupies some parts of Maharashtra, Gujarat, Punjab, Haryana and Rajasthan. This is what the composition of real stones. Maybe they are calcium oxalate stones, or the mixed stones, calcium phosphate, calcium oxalate will constitute 70 to 80%. Then magnesium, ammonium phosphate, uric acid, cysteine. This calcium oxalate monohydrate is the main culprit. It is more potent as compared to calcium oxalate dihydrate. It is thermodynamically more stable. And now the mystery lies in the organic matrix. It is not as simple as the stone itself. There is an organic matrix on which there is an epidactic growth of calcium oxalate, inorganic calcium oxalate. This nucleus, which comprises the organic matrix, it comprises 2 to 5% total stone weight. It is majorly composed of proteins. 64% proteins are there in this nucleic matrix. And lipids are 7 to 12, followed by carbohydrates and glycosaminoglycans. Normally, the urinary conditions are highly saturated with respect to the minerals. However, in the pathological state, we have seen, this is based on, I used to read about it in the literature, but when I started working on it, and I thank all my PhD students who really played a very important role in that, in helping, deciphering what is the mystery behind it. I have also been working in the field of medicinal plants. Tanzeem worked on that, but this part is done by my another PhD student. This is not done by me, I'll be very frank. My PhD student is responsible for it. So we have seen that in organic matrix there are both inhibitors and promoters. Inhibitors are also there, which inhibit kidney stones. Promoters are also there. Some urinary bioregulatory molecules, especially proteins, while exhibiting their modulatory activity on calcium oxalate, which is the most prevalent form, gets incorporated in calcium oxalate crystal. Calcium oxalate I will be referring again and again because that is the main culprit. It aggregates, resulting into the formation of organic matrix of kidney stones. Proteins being the key regulators and the principal components, so we started investigating their role in crystallization. Even those several proteins, not by me only, by other scientists working in this field, they have deciphered so many proteins, they have characterized them. In my own lab, we have characterized around 25 proteins which are involved in kidney stones. From the kidney stone matrix itself, I'm not talking from the plants, that is a separate topic. Therefore, we assess the impact of human kidney stone matrix on calcium crystallization and its damage to the renal, proximal, tubular epithelial lining. So I ventured into the field of proteomics, where I got training. My postdoctorate was in the field of proteomics. So I used that technique when I came back here. to study the molecular fluctuations occurring in response to cell-crystal interactions in hyperoxygenatic conditions, so that we can get an idea what is the mystery behind it. So that's what we did. Effect of human renal calculi extract and renal calculi metric proteins after calcium oxalate induced cell injury on cultured renal tubular epithelial cells. So we took, as you can see here, we have a tie-up with PGIMEA. So we took calcium oxalate kidney stones. They were washed as a typical method of extracting those proteins. So I straight to come on to this. This is a very first, very basic ability to inhibit nucleation, aggregation, and also promote. So this was the basic side, and we could see the increasing concentration of the proteins. We saw good activity. I'll move on to now cell lines. So to make it simple, the graph might look not so easy, but they are very easy graphs. So what we did, we took 3 cell lines. One was from rat NRK52, from canine MDCK, and also from human HK2. So this was done to study if there is any species-specific difference. And in my subsequent slides, I'll explain there was no species-specific difference. This is an MTT cell viability assay, which is very evident in itself. You see here that in the control cell viability is 100%, and with the increasing, we also did control, solvent control, protein extract. Protein extract are the proteins which we isolated from human renal kidney stones. This is COM. COM is nothing but calcium oxalate monohydrate. What we did, we injured all these cell lines with calcium oxalate monohydrate. We injured them. This was to emulate the conditions taking place in vivo. We also have done lots of, and we have established animal model, but this presentation of mine is not going to be talking about that. So in fact was the kidney stone metric proteins, as you can see here, they show 20-25% cytoprotective activity with the increasing concentrations at specifically 50 microgram ml against COM. COM is calcium oxalate monohydrate on renal cells. On all this, and this was similar pattern in the case of all the 3 cell lines. This is the flow cytometric analysis. So what we did, as we know, typically people who are working in the field of flow cytometer, they know very well. There are 4 quadrants. As you can see here, the first quadrant indicates a life cycle. This is early apoptotic, late apoptotic, and necrosis. As you see here, protein extract was just taken as a control, where we see maximum life cells are there. With the COM treatment, this is a control. This is typically control taken triple CP to study apoptosis. In the first quadrant, with the COM treated, we can see that in the second quadrant, early apoptosis, there is 42.2% cells are there, 8.7% in the late, and necrosis 2.3%. However, when we added protein extract, which was coming from the renal stones, kidney stones, we can see here that there is decrease in the early apoptosis, and it is from 42.2% reduced to 29.3%. Similarly, was the case also with the late apoptotic cells. And our studies, in our virtual studies which we carried out, we found the similar pattern was there, what was observed in the case of NRK52E, almost similar from human kidney cells. The difference between these 3 are, not only are they from different species, HK2 and NRK, they are proximal cell lines, proximal tubular cell lines, and this one is renal, this is epithelial cell line. Yeah. So since we found that apoptosis was being modulated, so we thought let's look at the executional enzyme caspase 3. Caspase 3 is an executional enzyme.
Can I ask a quick question?
Oh sure.
You didn't take any distal DCT cells.
Distal, yes. The MDCK is distal, proximal.
And the other one is?
Other one is proximal. In fact, in my next study, I am taking IMCD also, that is collecting tubule. Since in the previous slide it was observed that apoptosis is being affected, So we thought, let's look at the execution enzyme, caspase 3. Caspase 3, we all know, sustain aspartate protease family. So we saw that in the case of COM treated, as you can see here, this is blue versus pink. The population on the left side, blue dot, depicts the percentage of the cells with inactive caspase 3, these are viable cells. And M2 population, right pink, is the percent of cells having active caspase 3 enzyme, including the pop protein or dead cells. And there is a significant difference. In the COM treated, we can see caspase level, you can see here. Whereas when protein was added to the COM, we see that it is decreased in this peak M2, which denotes caspase 3. And to make it very short and crisp, similar pattern we also saw for MDCK and also for HK2. So this motivated us to go ahead with these studies, and we published the studies in journal in 2023 in Life Sciences. Then we thought, let's go ahead with the cell crystal interaction study. So this slide shows the effect of kidney stone matrix protein extract on calcium oxalate monohydrate induced cell injury in NRK. So we started focusing on, I'm only giving representative slides here, otherwise the slides number will increase too much. It was visualized under phase contrast, contrasting enhancing microscopy. And we saw here the NRK cells were treated with COM crystals. This is maybe these are not so matrix proteins treated cell was found to be healthy, indicating no adverse effect on the cell, renal calculi extract on the cells. Morphology of NRK52E. NRK52E is the rat kidney cell line, this proximal one. They got distinctly distorted as the effect of COM crystals induced insert. However, the effect of COM crystal injury to NRK cells was significantly reduced by human kidney stone matrix proteins. This was a common feature which we saw by virtue of all these experiments. This is again was very interesting. We did scanning electron microscopy of COM. This is how COM looks under scanning electron microscope. It is this is a shape. They call it a dumbbell shape. I don't know why it's called a dumbbell shape, but it is called because I know what dumbbell looks like. It is not exactly like a dumbbell, but it has very sharp edges. An elongated hexagonal COM crystal with sharp and piercing edges adhere to the cells. That's how a calcium oxalate monohydrate crystal adheres to the renal cells. And so we observed some kind of thing there. However, on co-treatment of this with the proteins, we found that there was modulation in the COM crystal. This modulation is very clear, very you can see very clear there. Kidney proteins curtail the pernicious, the harmful effects of COM crystals by dissolving their edges. Edges were smoothened, stone was fragmented. Now to examine the altered protein expression. These studies I am showing now with human kidney cell lines. Let's venture into now the field of proteomics and do some differential proteomics by eye-track, which people who are working in this field, so it's a very robust technique these days. Data-generative eye-track analysis reveals significantly upregulated proteins in COM crystals exposed cells as compared to untreated control group, which I'll be showing in the next table, in table 1. This is the one. We saw here all these proteins were upregulated upon their exposure to COM crystals. We also found that 41 proteins were found to be downregulated. The upregulation, also downregulation. In the COM injured renal epithelial cells, there were 41 proteins which were downregulated. This was the data coming out of eye-track. So this is then we did string protein interaction studies, and we found that the string-based protein network function analysis, it was categorized into these group of proteins which are involved in the COP process, calcification, cell crystallization, calcium hemostasis, inflammation. So all these proteins which we found, we categorized them with few of these programs. In the first investigation, kidney stone matrix protein diminished the extent of COM injury to renal cells, thereby alleviating the upregulated inflammatory and stress proteins. In contrast, several proteins were found to be underexpressed due to common insult, which were concomitantly normalized. We saw them normalized in the presence of kidney somatic proteins. This was, I'm very close to now finish. In order to validate whether kidney somatic protein actually played a role in elevating the increased levels, we thought let's do some more analysis of these two proteins, inflammatory and stress proteins. OPN, osteochondrial protein, is very well. This protein is very well already. It is there in this. People who work in this field are very aware of this protein, osteopontin, and also heat shock protein HSP70. So we did these experiments using confocal and real-time PCR. This is not very clear here, but we did immunocytochemistry for detection of protein expression. We also did the PCR for that. And we found that in the calm injured renal cells, the expression of both OPN and HSP was profoundly evident in the form of red stained cytoplasm here. I can see red here, but I don't know whether red color is really visible here or not. As a consequence of stress and inflammatory pathways activation. However, the intensity of the red fluorescence related to the expression levels of both stress marker was significantly reduced in the presence of kidney somatics. This was again evident in this particular figure. In the real-time PCR, we did mRNA expression of both OPN, osteopontin, and also for HSP. Similarly, the mRNA expression of HSP70 in the calm crystal cells was elevated to 5-fold as compared to the single-fold. And co-treatment with kidney somatics extract diminished the expression level of HSP70 and also of OPN. So which further confirmed the fact. Now we can say by virtue of all these experiments, yes, matrix proteins do play important role. So this is summary and conclusion. Human kidney stone matrix proteins are found to have anti-lithiatic. Lithiatic means stone, lith means stone, anti-lithiatic activity against calcium oxidation. These proteins significantly attenuated the extent of COMP-induced apoptotic injury in renal epithelial cells. Protein crystal structure modulatory activity of human kidney stone proteins was also observed. So we examined these proteins which we talked about by our track. I will not read it again. Therefore, it can be concluded that human kidney stone matrix proteins exert their anti-lithiatic potentials through interacting directly with the COM crystals. So I emphasize on this time, directly with the COM crystals, consequently inhibiting the crystal cell interaction, which is a prerequisite to initiate inflammatory response. So this was a model which we proposed based on this. This is how COM looks like. It goes and binds to the cell crystal adhesion. Internalization takes place, resulting in upregulation of pro-inflammatory and crystal binding proteins. However, in the presence of kidney stone matrix proteins, you can see there is a change in the shape which I showed by SCM studies, and resulting to attenuation of toxicity. So we can conclude that human kidney stone matrix proteins exert their potential, anti-lithiatic potential, through interacting directly with COM crystals, consequently inhibiting crystal cell interaction. This is actually the gist which came out of all these studies. So these were the two papers which I presented. One was in life sciences, other was in chemical biological interactions done by my PhD student. And we have collaboration with Dr. Shravan Kumar Singh from PGI. And in this study we have collaboration with IGIB with Dr. Shantanu Sengupta, who is an expert in the field of proteomics. Thank you so much.
Thank you. Really informative, especially because at one time, quite maybe around 10 years back, we used to actually, analyze kidney stones from the hospital setting. Then we used to look at the diffraction pattern, how the diffraction pattern, and we used to tell the clinicians, the gastroenterologists there, whether what urologists there actually, what all it contains, so that it was useful to them for treatment. So I was wondering whether that is the sort of role that you also play, when you tell them what it is composed of.
Absolutely, ma'am. Actually, conventionally speaking, whenever a person suffers from kidney stone is extracted.
The composition
Yes,
matters.
and absolutely very important. Then mainly it is 70 to 80% calcium oxalate. That's what doctors do by analysis. But uric acid stone is again coming up now. Uric acid made of mainly proteins are responsible for that. But this is just the inorganic part. We looked at matrix. It is not just the inorganic calcium oxalate, there is a nucleus organic matrix on which there is the growth of calcium oxalate or calcium phosphate. So we looked at this matrix, what is there in it. So we found this matrix has both inhibitors and promoters. So I showed you activity of those proteins coming. But you are right, that's how it started.
Okay. Another question that I know Shantanu very well, he's very good. So I was just wondering, when you did that analysis, did he use you used only one kidney stone or you used several kidney stones for that analysis?
I know what you're saying. We used a good number of kidney stones together because the amount of protein or the concentrated protein is very, very less.
That is where the question comes in. Were they similar kind? How did you make sure that they were the similar kind of?
Yes,
again. Dissimilar than the.
I know. This is a question which has been coming up again and again when I submit my papers also for peer review. We did FTI analysis, which was done, and we only took calcium oxalate stones specifically. We didn't take mixed stones. We didn't take magnesium, ammonium phosphate, then not struvite, neither uric acid. But this question was coming again and again when I started my study.
Because I'm also involved in proteomics analysis, but of generally cancer. But so that the tissue sample is always a question.
I know.
Thank you. Questions?
Okay, Dr. Tandon, actually those FTIR results are from our lab. We do as a patient service. I'm in biophysics, Chandigarh.
Shalmoli?
Yeah.
Oh, how are you?
Okay, yeah, it's a closed group. Anyway, so we have it as a patient care services. So what I wanted to know was, like, you have just selected the monooxalates. So in general, what we see is a mixture, it's Vedolite and Bevelite.
Yeah,
So do you think those interactions are going to change if you have done in one set? So what is your
okay.
You have experience, because I don't do any work on that. It's
that's an important question. I think what she is asking is there are two kinds of calcium oxalate stones, Vedolite.
Yeah, this is mono and di.
Monohydrate and di. So actually, Dr. Shalmoli, it is calcium oxalate which is playing the, it's a villain in this, not calcium oxalate dihydrate. However, both are there. Calcium oxalate monohydrate is thermodynamically very stable, and in fact, we have seen not only in our studies from our lab or from other scientists who are working, they say the moment COM is converted into COD, that means there is a protective effect. However, it changes only the shape, only the inorganic part, but the organic part remains.
So that means those interactions are going to be same.
Yes.
But otherwise, there's not going to
No,
be.
it is only the morphology and only the inorganic part also.
Thank you.
Okay. Just a quick question. Very elegantly designed studies.
Did you really wonder sometimes that I should do a dose dependency study to see the protection?
So we did, Rajeshji, we did the dose dependent also in this case. Maybe it didn't come out in my slides, but everything was done in dose dependent manner. Yeah.
And does it go down at some stage?
Yes. In fact, in my very first slide when I showed, we did, which was not based on the cell line, we did nucleation, aggregation and growth. Rather growth, we found that with the higher concentration, growth was promoted rather than being inhibited because it's a mixture of promoters and inhibitors.
Thanks.
Hello, Dr. Zavan. How are you?
Fine. What about you?
Very fine, sir.
Sorry, I missed it.
Any more questions?
Thank you so much.
Thank you, sir, for helping us understand the pathophysiological role of matrix proteins in study of kidney stones. I request the chair to kindly felicitate Professor Tandon with the memento of our appreciation. Due to unavoidable reasons, Professor Gangaram will not be able to present his talk. However, we have Dr. Rajesh here with us this morning. I request the chair to kindly introduce our final speaker for the session. Thank you.
Dr. Rajesh Kher is the Director of Business Operations and Regulatory Medical Writing in Janssen R&D, Johnson & Johnson. Recently joined Data Analytics and Reporting Group's Robotic Process Automation Governance Body, heavy, as a member representing Regulatory Medical Writing. Before joining Janssen in 2010, Dr. Rajesh was Associate Director and Head of Medical Affairs, Medical Writing and Pharmacovigilance at GVK Biosciences, and a Senior Scientific Communications Associate at Eli Lilly and Co USA. He is the alumni of this department, and he has done his PhD in Molecular Endocrinology at SGPGI, and he has done several postdoctoral fellowships. He has a certificate in clinical research program from Indiana University, Purdue University at Indianapolis, and is a ProScience certified change practitioner. What is that? That is what is
change management. That's what I'm going to try to do today.
Okay.
Here.
So you're going to change the outlook. So
The outlooks, yeah.
So I welcome you.
Thank you. Thank you for this introduction. Thanks everyone over here to come and listen to me. This is my homecoming. Thank you to Professor Ashwini Kaul, Dr. Avneet, and everyone else, the organizers over here. This has been a wonderful homecoming for me. I belong here. This is kind of my second home. So I'm very pleased to be here speaking in front of you. I'm going to take you away a little bit from academics. Yesterday while coming, I was picked up by two wonderful gentlemen, and I think one of them is over there. So maybe the other one also. Can you identify yourself, please? Yeah, both of them are here. So while just talking to them, and I asked them about how things are going, and one of the things that came out was they really are worried about what next, and what are the opportunities they have. And I'm going to talk about that today, try to see if I can find some answers, get some answers for them. So my standard disclaimer that these are my opinions, not necessarily of any organizations that I have worked before. And also I want to acknowledge slides provided to me by Shalini Trivedi. I thought they were very good, and I listened to her before, so I borrowed them. I worked on those slides actually yesterday coming on board Shatabdi, and I hope there aren't any typos in there. Oops. So this tells you how inexperienced we are in making presentations when we move to industry. Alright. Let me try to get started. Okay. So, when we start talking about our career choices, right? So we start thinking, we come to Punjab University, we come to a great university with great programs, integrated masters, and what better can it be? You don't find that kind of a course anywhere in India, at least that I know of. So you are taught not just your own subject, you're taught a wide variety of things, biochemistry, chemistry, physics, microbiology, whatnot. And probably something that used to be lacking in our time, what is a drug? And I'm going to come to that a little bit later. So when you ask these questions, so first thing that I always say is ask yourself what do you want to do, right? What hits you here? So probably some of you came here because you couldn't find admissions in something else, or your parents really told you that you want to go to Punjab University and do a master's or a PhD and all that stuff. But ask, is that what we wanted to really do, or is that what we want to choose as? Present day is no longer that. It doesn't hold true at all. There are a lot of avenues out there, and you just have to say, do I want to do that? capable enough to fit into there. So these jobs can be academia, industry, or business and startups. And startups is the new buzzword these days. You want to pursue higher education? Is that master's? Is that PhD? Is that postdoctoral fellowships? And good guide for your masters. I always used to wonder, what does a good guide mean? The person who is at number 1 is better than the person who is at number 9. That was always the confusion I had. So I always used to think that's not disrespectful to the teachers. That's also disrespectful to us. Right? Should it be good marks? Should it be the field that we want to go? But it used to be at that time, Professor B would be number 1, and the topper would go to Professor B, and someone would go to Professor C, and all that kind of stuff. So I hope that doesn't continue. So when you pick up your choices, don't go by that marks are important. They are not the only thing in your life. What you need to focus on is really knowledge, and if you get marks, it's a bonus. Then when you start looking for careers, know your strengths. Very important. Know your weaknesses too. Play on your strengths and manage your weaknesses. Do not focus a lot on your weaknesses. Just know what I'm good at and really concentrate on that and try to manage your weaknesses. Your scientific knowledge is going to be very paramount when you graduate out of Punjab University. What is important is your scientific knowledge. And you learn most of it. Physiology, disease, I can tell you, all over the world, very few people get so much of exposure as you get in biophysics department. When you walk out, you know a little bit about each and everything. And that does help. That really, they say the jack of all trades and master of none. That's fine. When you go out of biophysics, what you learn is almost everything, and you get a wider range of things where you can really step into. And that's very helpful. Technical skills, PowerPoint, Word, very important in industry. And something that we all, and Chandra will always tell you because he has been part of a lot of departments in MIT, he'll tell you how important it is behavioral skills and especially attitude. Attitude is very important when you go for an interview. Good interviewer is not going to ask you questions on diffraction. It's not going to ask you questions on physiology. They are going to focus on looking what kind of attitude you have. Do you have an attitude of I can do it? Do you have an attitude that I will be very friendly with people? I will be believing in teamship. I will be believing in good communication practices. Those are the things that a good interviewer in a good company will always look for. And then the healthcare industry is no less. Please remember that. It's no less challenging and exciting. So quickly moving on to my story. So I did my PhD. And actually, unfortunately, I don't have a mic, collar mic. I like to move around. I got a lot of excitement and a lot of energy, which Ashwini knows.
We can give you.
Yeah, that may be better. Thank you. So I did my master's, as you know, bachelor's and master's here. Dr. Dhawan was my teacher, one of my favorite teachers in those days. So I mean it. I did 2 postdocs, one in University of Chicago and the other one in Indiana University, where I became a research assistant professor. Then there was always this thought of returning to India, and always your family doesn't want to come back, whether you want or you don't. If you say you want to come back, the wives don't want. So that was this thing, conundrum. So I said, okay, my wife said, we're not going to earn a lot of money going to Punjab University and becoming a professor and all. Probably yes, we don't make a lot of money here in academia. So money was important. So we said, let's move to industry. So I moved to Eli Lilly, and And then this question, the same question that all of you have, what do I do? How do I move into industry? I have spent all my life in academia, which I loved. I definitely love. I would never have moved into industry despite less money, because I love research. So I had to make a compromise, family and money. So I said, let's move to industry. Now, how do I move to industry? It's very difficult. How do we start from zero? So the things that I knew was, I knew writing. Right from writing ABC as a 3-year-old to love letters to my fiancée, and then my kids writing letters and all. So English came very naturally to me. The communication came very naturally to me. So I thought, well, let me look around. Where can I use my skills? So the first thing was, how do I make my CV? So when you go out of here, if you want to make a career, if you want to make a career in academia or into industry, remember that your resumes have to be really well written, and to make them strong is, if you are going to Honolulu, go and get a certification from Honolulu. Probably not the best thing to do, but that makes you saleable. If you are going to Utrecht, find a university in Utrecht and I'm just making up those names, I don't know whether Utrecht is a place. So find a university over there and get a certification course where you don't have to spend a lot on your project. You think about your students, you think about the next day lectures and all. Sometimes it becomes too much, right? At least for me, not for everyone, right? So industry gives a very good work-life balance. 9 to 5 you're done, right? You don't think about anything. If someone tells you that no, we work very hard and we do this, they are lying. I can honestly tell you, I speak this from any platform, always. The line 9 to 5, 8.5 hours is what industry means. And my first mentor in university also used to tell me, he would tell me, if you can't finish an experiment in 8.5 hours, you can't finish it in 12 hours, right? And you are inefficient. So work-life balance, but I didn't have any idea about drug development. Punjab University Biophysics, we never learned. We had our colleagues in BMS block in pharmacy, so didn't know about drug development. Then, like what I said, I took a certificate course in clinical research, just 4 days. But this helped me land a job in Eli Lilly. I had written manuscripts, abstracts, so the next few slides that I'm going to show you is, if you read those, it will help you in really understanding how fit you are in a job that I'm talking today about, clinical research. So you know all of those, genomics. Didn't we just hear a wonderful talk from my dear friend Chandra on proteomics? He talked about proteomics, right? You know all of it. Genomics, you know about computational chemistry, biophysics, right? You know all of those. And spectrometric methods, right? So when Professor Dongre talked about it. So I just typed it then when he was saying, I said, let me just type it, and there you see it. So you know all of it. Then drug discovery approaches. You have all understood. You all know about it. You know about chemistry. You read that, right? And these are physiology, molecular biology, all of this you all know. So you are fit for this job. I'm doing a salesmanship for my company here, for my industry here. So you all, if you decide tomorrow to go into clinical research, go with the knowledge that you really belong there. You know it all. So what are the players in drug discovery? In clinical research, drug discovery is very important because that's where from it starts. Who are the people who find jobs here? People who know molecular biology. So if you know molecular biology, you can go into drug discovery. Biochemistry, pharmacologists, toxicologists, chemists, all of those people, they can go into drug discovery. And Professor Dongre said, he said that as a biophysicist, using nanotechnology, you can go into drug discovery. So some of the terminologies that are used in clinical research, and I'm not going to take you because I won't be able to teach you clinical research in 1 hour or 30 minutes that I've been given. But some of those that we use, and I'm going to read out, clinical research as per National Institute of Health is research that is patient-oriented. That's us, right? That's our family members. Those are our neighbors. All of us, patient-oriented, includes epidemiology and behavioral studies and outcome and health research, health service research. And then we use the word clinical trials. Clinical trials are, and Professor Dongre said that this will lead eventually into preclinical and later into clinical. That means in testing in humans. That's prospective biomedical or behavioral study designed to answer questions about intervention and determine safety and efficacy. Don't we do that in our master's research? But in animal models, in other preclinical models like cell culture and stuff like that. The other thing that's important in clinical research is knowing what a subject is, what a participant is, and that's what we talk here about is clinical trial volunteer. So these days, some people don't like to be called as patients because of the sensitivity of guinea pig syndromes. So we now talk about participants, or we talk about volunteers. Individuals and their private health information that are participating in a clinical research study and do not want an investigator. Those are healthy volunteers or patient volunteers. Okay. So from here on, so I'll quickly take you through slides 13 to 20. Those were shared by Shalini Trivedi, and I do have her permission here. However, I'm not responsible for certifying the references cited in these slides. I didn't have internet on Shatabdi yesterday, so I just couldn't check. So,
Spoken like a true industry person.
yes, I have to give my. Right, so clinical operations, that's the first thing. So many of you who like traveling, how many of you like traveling here? And how many of you like interacting with people? Alright, so reach out to me, I'll give out my email address, I'll connect you with people who have jobs in clinical operations. What do clinical operations people do? Anyone has an idea about it? Who can volunteer to say what's operations? What does operations mean?
Slides, no, there. Just replace your practice.
So operations mean doing something, right? So that's what they do. They manage the trials. When there is a drug that moves out of academic research or industry preclinical research, right? A drug that we want to test. So we want to test it in healthy volunteers and later in patient population, right? But there has to be someone who goes to those doctors, the clinical investigators, and provide them with the drug material, right? And has to see that everyone gets the same thing. So each and every one gets the same thing without any bias, right? And these are the people who go, they're trained by industry to do things in a particular manner, right? We call as standard operating procedures. The difference of working in industry versus academia is in industry, you really follow rules that are set by others. In academics, you get a wide variety of thinking. You have a lot of autonomy. Unfortunately, industry doesn't provide you autonomy of thinking. It happens like every 3 to 4 years, they start again coming in groups and start coming up with things. Things may move in just 1 year, but they will still stick for a couple of years, unlike in academic research. So these operations people, they have to follow standard operating procedures that you have to work in this fashion. But what is exciting about this, and that's what I wanted to tell you, you can travel a lot, right? It's all paid. You stay in great hotels, you get good food, you get to meet with people, but you have an important role to play, You have to ensure that everything is done properly because we are testing on humans. I'll skip through this slide because this is not much of where we can go. We see that in India a lot of people go there, but I know my biophysics people here, this isn't what they would want to do. This is more about programming and computing and all, unless you really know. And biostatistics, not many of us really like it. Do we like it? No. Okay.
It's a very important component.
It's the most important, but we don't like it. We may not fit in there. That's what there would be people. There would be people who are from biostatistics, right? They would fit in there because this is like what Professor Dhawan said. It's very important. They design our studies. If we go there, we may screw it up because we are biophysicists. We do separate things. It's a very specialized field, biostatistics. Like we can be a clinical doctor, right? And these are two things: clinical study responsible physician and biostatistician. You really need to have degrees in biostatistics to become a biostatistician. You won't be allowed. Then this is the area that I am in, and a lot of you can fit in there. That's medical writing because right when we start publishing our papers, we start writing our manuscripts, we start writing in grants and stuff like that, and we do have good communication skills when we really enter into our first year, even then. So what do medical writers do? There are two types of medical writing that is done. One is regulatory writing and the other one is publication writing. Right? So I'll again go back very quickly. When I went for an interview at Eli Lilly for medical writing, so I went for publication because publication came to me very naturally. And I've written grants, I've written manuscripts and all. So it was a position for publication writing. Suddenly, during the interview, my manager, later on she became a manager, she asked me, do I want, they do have positions in regulatory writing, do I want to go there? I said, ma'am, I really don't know what that is. Do you mind getting on the board and telling me that? That was an interview. And she got up, she explained, and I said, publication I can do with my eyes closed, but if you train me for a week or so in regulatory writing, I can do that even. If you go with that confidence, I know I used to compete getting 15th position in my class out of 15 people. I know many of you must be toppers and all, unlike me. So you can do it better. So if you really have that faith in yourself, you can become good medical writers, be that in regulatory or in publication. In publication, you can help in grant writing, you can help in making patient leaflets. In regulatory, that is when we do trials, the data comes. The data comes to the data management person or the clinical quality management fashion. And then it moves to a medical writer, and the medical writer does one of the most important things. He uses the brain, uses the scientific knowledge, and processes that, understands information, understands the biostatistics, but only a limited level, and then writes that down. That goes to the clinical physician and the biostatistician and other people who review it and come up with conclusions. That's regulatory writing for you. Regulatory affairs, again, very high paying, can go really up to vice president, president level of the company, is regulatory affairs. And what do? They talk to the regulatory authorities like Drug Controller General of India or US FDA or India and all. They talk about them, they talk about what applications we are filing, what kind of disease areas we are filing these applications for. Excellent for this group here. There's the medical affairs, more MDs and all you find going in there, but you find a lot of PhDs. They bring worldwide more PhDs in medical affairs than in India. In India, we have more MBBS and MD people going into medical affairs. Again, because of your therapeutic area knowledge, because of your disease knowledge, understanding of physiology, you can have a great career in this. And pharmacovigilance, in your neighborhood, one of our seniors from microbiology approved. So he created a huge company, QSI, in Chandigarh, and it got sold by one of the largest CROs, contract research organizations in the world, Parexel, and you do have Parexel here. They hire a lot of people from Punjab University, and there's a lot of retention. So people look up to Punjab University from Parexel to get people from here. They usually hire people from pharmacy, from microbiology, I hope from biophysics too. There used to be a company called as Heron, again a global company, was bought by Parexel. So Parexel is in your neighborhood. If you're looking for jobs, that may be one place. So, moving towards some more interesting parts of my presentation, these are some of the skills you should look for. Adaptability, authenticity, being ethical is very important in clinical research. Again, because we want to rush out drugs for the patients who are waiting, right? There are so many diseases out there, cancer. So everyone really wants new drugs, new classes of drugs. So you have to be very ethical while doing trials, while doing clinical research. So some of those are here, and again, you don't have to be born with those skills. These can all be acquired. So we used to have this Doordarshan. How many of you are aware about Doordarshan? They used to say, "Rukawat ke liye khed hai." And that's what happened. Well, this is a slide. Just focus on it. I'm going to ask some questions. So, can anyone say why did I show this movie here? This is such an academic place. Why did I show this movie?
Maybe I think you want to say that you identify your target, how to do it through automation.
Ma'am?
I think it's a perfect demonstration of chain reaction. How one thing.
Wonderful. Anyone else?
Such a precise way of making things.
Wonderful for yourself.
Speed also. Tools also. Tools.
Yeah. So all of those are right answers, right? The reason I showed is first it came to my mind, I'm coming to my alma mater. So BMS block, right? Pharmacology, pharmacy, biophysics, biochemistry, and microbiology. Very important in my industry, right? So different tools. Cohesion, right? Working together, working with efficiency, working with quality,
and eventually you get a right quality product. That's why I wanted to show you the attitude, the aptitude, the skill sets you need. They're all required to bring a great drug to market for the patients who are waiting. And that's why I wanted to show this. Thank you for the answers. Next one. So a couple of more slides. Do I have time for 5 minutes?
Yeah.
Okay, great. All right. What do I need to do to get into clinical research? I talked about it briefly. Choose the field of clinical research that you wish to choose as career. There are many other, just Google it, you'll find. I just showed some that could be very good for this audience over here. Research about this field from your friends, seniors, from web, from industry leaders and others. Attend any good short-term courses available, one that just about tells you about clinical research, trials, management, analysis of data, reporting of data. Beware of bad institutes. Don't join if the reviews aren't good. Don't pay a lot of money. Well-written resume is a must. Share your resume around. Attend conferences. These are great places for networking. You meet people, make a brief resume, not more than 1 page, and give it to people. If you can make your business card, really wonderful. Even if you're a student, you can write student seeking a job in your card, provide it to people. Prepare well for your interviews and never shy away from asking for salary. You should read about salaries, right? Once they ask you, they force you for salaries, then talk about salaries. Never ever talk about it yourself. You may be underselling yourself or overselling yourself. Very important to know about these kinds of things. So towards the end, clinical research industry is an attractive option for people who want to explore the world outside of academia. University graduates with PG degrees, PhD, and postdoctoral training in fields as diverse as medicine, biophysics, biochemistry, microbiology, pharmacy, physiology, molecular biology, genetics, and more can be highly successful in clinical research. Working in clinical research can not only be scientifically a fulfilling vocation, but also be very rewarding in terms of remunerations and managing a very healthy work-life balance. Global clinical trials market size is expected to grow from USD 54 billion to around USD 85 billion by 2030. India continues to be a preferred destination for clinical trial outsourcing. There has never been a more exciting time to enter clinical research profession and help make a difference in people's lives by contributing towards bringing novel therapeutic agents, drugs, and diagnostic elements and also devices to the patients who are waiting.
I am part of a lost generation.
I refuse to believe that I can change the world. I realize this may be a shock, but happiness comes from within is a lie. And money will make me happy. So in 30 years, I will tell my children that they are not the most important thing in my life.
My employer will know that I have my priorities straight.
Because work is more important than family. I tell you this. Once upon a time, families stayed together. But this will not be true in my era. This is a quick fix society.
Experts tell me 30 years from now I'll be celebrating the 10th anniversary of my divorce.
I do not concede that I live in a country of my own making.
In the future, environmental destruction will be the norm.
No longer can it be said that my peers may care about this earth. It will be evident that my generation is apathetic and lethargic. It is foolish to presume that there is hope.
And all of this will come true unless we choose to reverse it.
There is hope. It is foolish to presume that my generation is apathetic and lethargic. It will be evident that my peers and I care about this earth.
No longer can it be said that environmental destruction will be the norm.
In the future, I will live in a country of my own making.
I do not concede that in 30 years from now I'll be celebrating the 10th anniversary of my divorce.
Experts tell me this is a quick fix society, but this will not be true in my era. Families stayed together once upon a time. I tell you this, family is more important than work.
I had my priorities straight because
my employer will know that they are not the most important thing in my life. So in 30 years, I will tell my children, money will make me happy is a lie, and happiness comes from within. I realize this may be a shock, that I can change the world.
and I refuse to believe that I am part of a lost generation. So how many of you believe in this? The second part versus first part. First part, people, raise your hands. And the second half? Did everyone understand what this video was about? Right? One was about pessimism. The second one was about optimism. Just by reversing pessimism, just by reversing what they said before, it went in a reverse order, and there was just optimism in there.
Actually taught another lesson, how to present yourself and to say your words.
Yes, absolutely. So communication, again, ma'am pointed out a great thing. So I end my talk today with Swami Vivekananda's Ji's famous saying, arise, awake, and stop not till the goal is reached. Open for questions, please.
I think the younger generation should have many questions because we opened up another
Yeah, I really want it to be interactive. Please, if you really think it's helpful, we can ask your teachers to stay out of the room. I don't believe that is required, but if you really think you can't ask questions, this is a great place. Biophysics is a great place. I know my teachers. I know Dr. Dhawan. I know Dr. Kaul. They really were wonderful teachers. They encourage us to ask questions. So please feel free to ask questions. And this wasn't by no means what I actually saying academics is bad, because I say this is a regret that.
venture out of that thing. So there has to be industry and maybe having your own startup or
There's always a collaboration between the
Yeah, there cannot be one-sided, because the drug development cannot happen. It cannot happen without academia, because the drugs come from basic research. They all come from there, and with computational biology and all, we know these days with bioinformatics and all, drugs are coming from there. There is no longer chemistry. Yes, sir.
Actually, sir, so many of the industries don't put in the advertisement as biophysics education, PhD or MSc, and because of this, student can apply for this. So how do we overcome this problem?
They are mostly life sciences now.
Life sciences they put, but they prefer biophysics.
Yeah, I think it's a failure of biophysics departments itself not really talking about biophysics enough. This is a great start, having these conferences, and go out of university areas. If you talk about All India Institute of Medical Sciences Biophysics, I was just talking to ma'am, Dr. Vivek Ahuja. He's a huge name.
he's not the only one. We have at least 7-8 people in
There are many. So it depends on, do you want to really venture, right? And again, academics is great.
And Vivek started his career, his MD supervisor was Dr. Geeta Subbarao, and she did molecular modeling. So his basis is molecular modeling and drug design. So from there he moved.
So there is, you can really go up and up in industry. The advantage of biophysics, the way we were taught, was we knew almost everything about everything. I came with a mathematics background, learned zoology, botany a little bit. I hated botany. Learned a little bit about it, and then went to endocrinology. From endocrinology, I spent 11 years in nephrology. And from nephrology in something. Right now, I don't do medical writing. That's a disclaimer I didn't mention. I am into business operations and automation. I do a lot of artificial intelligence, and from Sunday, I am starting my course in AI for four months, and I'm at the fag end of my career. So there's no stopping if you want to venture.
effect. And even at pre-public test you don't see this, but this is not surprising, right? Because if you remember how difficult it is to inhibit protein.
So I'm going to talk about a part of my research work. This is not a complete part of this research also. So at the advent, I would like to say, like Dr. Rajiv said, it is like everything is vast. So I started my career as a crystallographer. Now, because I'm in AIMS, I'm also doing proteomics, genomics. So these are very different fields. So you can, invent into any field that you like, provided you have the interest in learning. This is for the students actually. So collaboration is yes, but you can always change. And if you go to industry, you have to change your field. There is no way out. So my topic of the research, what I'm going to present today, is search for potential aura kinase inhibitors as probable anti-cancer agents. So I just wanted to introduce the field of drug discovery and development, till where we can go and from where you have to give way and you have to start collaborating and search for an industry partner. So basically, what all we do in the laboratory actually forms basically just the first two of these, the target discovery and the lead discovery, or the target selection and the lead discovery. Then at least I start collaborating when you search for a medicinal chemist who will actually synthesize the compounds that are of interest. And then we do some of the in vitro studies, but we also again collaborate for the remaining of the in vitro studies. So here which I've actually identified over here is target selection can be either from bioinformatics sources or from genomic sources. Then lead discovery can be anything. You can go do a database search, or you can do a structure-based drug discovery, which we generally do. And then once you have the structure of the compound that you would like to move forward with, you actually synthesize the compound. And then you test the compound. It can be on cell lines, it can be on, using biophysical techniques, two of which I'm going to describe here, the others I'm not going to talk about. And then you have to do in vitro studies. You cannot move forward without in vitro studies, which are the animal model studies. And then comes the real process, because what you are going to give is only a lead molecule. It is just the beginning. It is not the end. That is when you have to start looking for a collaborator or an industry partner who will take it forward. And then there are many other things to it. What we synthesize is actually in the laboratory. We only synthesize a few milligrams, maximum 10 milligrams. The question now comes is whether can it be scaled up, whether that synthesis can be scaled up. And what happens is, like one of the compounds which we have got synthesized, that's a 20-step process which the synthetic chemist used. The industry is not favoring a 20-step process because that is very, very expensive. So that chemist was actually asked to reduce it to 10 steps, which, as far as I know, he has not done till now. So there are lots of problems which come into this. Now, they are basically, when you are looking at the structure, you have to know, or you are thinking of drug discovery, you have to know the structure of the protein. The structure of the protein can be determined experimentally or through computational techniques. So X-ray crystallography is one of them which gives you a very accurate but static, as we say, picture of it. And the big drawback of this technique is, or you can say a rate limiting step in this is getting crystals. Now this is being overcome by cryo-EM crystallography, cryo-EM, but what happens is, for cryo-EM, you need large assemblies. We cannot do it if it is a small assembly. So if you have small proteins, then you have to stick to crystallography, but otherwise you can do cryo-EM. But there is another technique which is now coming into the picture, which is XFEL, where you actually can have very small crystals and these can be put in and the structure can be determined. So actually structure determination is progressing by leap and bounds, and every time there is a new story over there. But supposing you cannot have crystals, but you have not a very large protein molecule, then you can determine the solution structure by NMR spectroscopy. And I think, I don't remember who, but somebody spoke about an NMR structure today. And then if you don't have either of these, you will have the structure but of a different species, and you want to work on another species. So you can actually do homology modeling, taking one of the structures from the protein data bank. And now if you don't have any one of these, the latest is AlphaFold, which is supposed to be one of the best AI models, which generates the best AI models today. So that is another step. So once you have the structure, to determine a small to determine or to do drug discovery, you need a small molecule. So for small molecule, when you are doing at least computational modeling, there are several databases which are available, which actually SNLE spoke about in his talk. And you can also do drug repurposing, or you give an old, let's say, a molecule a new name or a new task. That means the drug is already available in the market, it is used for another disease, but now you are testing it for another disease. And that is what Shelja actually presented in her work, where she picked up lots of other molecules which were available for other diseases, and she was trying to develop them as anti-malarials or test whether they are anti-malarials. But what I am going to talk about today is absolutely different from that. What I am going to do is, I am going to search for a molecule or search for a scaffold which is known to have a certain clinical trials. So I'm sorry, I'm making more into information of which students can also cover, so not for everybody. So now one of the most important things in drug discovery is the lock and the key model, which I'm sure most of you would have studied. So like every key cannot open every lock. You have to have a specific key for a lock. That is why you have to look at the structure of the protein, see where the binding pocket is, see what properties of the binding site are, and then design your drug to it. That is referred to as the structure-based drug discovery or rational drug discovery. And here I don't know how many, because when I was sitting there I could not see the lowermost, so I tried to raise it, but I still don't know. So this is a typical example of our previous work on phospholipase A2, where we have actually looked at the binding site and then developed a protein molecule, and this actually has been patented. So now, what are these aurora kinases? When you talk about cell division, we always talk about centromere amplification. And the hallmark of any cancer when you take, is actually cell division. And when you talk about cell division, you also talk about chromosomal separation. So there are a number of mitotic kinases which are involved when the cell chromosome segregation is concerned. And aurora kinases are one such mitotic kinases which play a central role in cell division. So I have actually portrayed over here two of these aurora kinases. One is aurora kinase A and aurora kinase B is the other one. So if you look over here, the red one over here represents aurora kinase A, and the blue one is, or the purple one, it seems like over here it's purple, is aurora kinase B. So the entry point of aurora kinase A is actually G1/S cycle, and here you can see some of them are there. And as you go into the mitotic cycle, the aurora kinase strength is increasing and concentration is increasing over here. And then you go to the pro-metaphase, and actually you can see the appearance of aurora kinase B. And generally, as the cell cycle or the cell division progresses, these aurora kinase A actually are present at the center, and they also move forward, and they are present at the spindles. So aurora kinase B remains at the center, but A moves towards the spindles, and here you can easily see that this is the cell separation which is now going to start over here. You have aurora kinase A at the spindle, and this is aurora kinase B, and the cell division. The moment you have dysfunction of a cell, then aurora kinases are seen to be increased. So basically these are, I'm just showing you here, these are a family of serine threonine protein kinases, and they basically have three types, A, B, C. The function of C is not very well established, so we did not work on that, though we have done some experiments, but we have not worked on that extensively, but we have explored aurora kinases A and B a lot. So as I said earlier, the overexpression of hyper aurora kinase B, the enzyme protein, is central to it. Now I just wanted to show that whenever you are doing, we also do what is referred to as sequence and homology or a sequence based study. And when you look at the sequences of these two, and here I've actually also put the domains over here. The aurora kinase A is the longest among them, that is 403 amino acid residues. Then is aurora kinase B, which is 345, and C as 309. Now if you look very carefully, this is all color coded. So whatever this from here, this yellow to yellow portion is basically the regulatory domain which is over there. So this is this is the catalytic domain, and here you find the activation loop which is in green, and you have a destruction box in black over here, and this black which you see in both A and B is the activation box or the destruction activating domain over here. Now typically if you see in aurora kinase C, this is not present, it is the shortest of them all. In aurora kinase A, this is much longer, and this is shorter over here. And one typical motif which is present in aurora kinase A and B but absent in C is the skin motif. This is nothing but lysine, glutamic acid, and asparagine over here. So this is a typical motif which is present, which is responsible for the activation of this activation box or this destruction box over here. Now if you compare the sequences of these proteins, just the catalytic domain over here, it is nearly 70%. But if you just compare the sequences over here, then this is between A and B, it is 50%, between C, B and C, it is around 60%, and A and C, it is again nearly 50%. Because we want to do an in vitro study, the compounds were synthesized, we cloned, expressed and purified the two proteins. And here I think Dr. Dongre spoke in length about fluorescence spectroscopy, so I will not speak about it now, except saying that we actually did a fluorescence study using a JASCO spectrofluorometer, and aurora kinase A has 4 tryptophan, so you can actually use the aromatic rings. Here we did a tryptophan quenching study, and the emission spectra was measured between 300 to 400 nanometer after exciting it at 280. So here what we observed was a blue shift in all the cases, and this was a concentration dependent study. So we saw that as you increase the concentration, the aurora kinase was inhibited more and more. So here when we calculated the KD, we found that for aurora kinase B, the compound 3 was actually the best one. And we did a similar study for B, and for this compound 2 turned out to be the better one. So I'm not going to go into more details of this for paucity of time. Then free fluidic study which we do. So there are 2 studies which you can do for protein ligand interaction. One is SPR and the other is PLI. SPR we could not do because our machine was not working at that time, so we decided to go for BLI. If I have 2 minutes, I'll just, you know what BLI is, or you want me to explain it? Okay, I can explain it later. So BLI is nothing but you load your compound on a sort of a capillary, and you make sure that only the compound is there, and then the ligand passes over here. And then the differentiation between the concentration of the ligand, that is what you measure. And in this case, we got similar results for aurora kinase A and aurora kinase B. So basically here I wanted to show that the association is this, and you actually dissociate the compound from the protein, the ligand is dissociated from the protein. And then we found that here we had got similar results as we got for fluorescence spectroscopy. Then we actually analyzed all the results, put them together, our computational results and in vitro results, and we found that they were similar to each other. So now there was a question that are these compounds toxic or not, or they work on the cell lines or not. So we did an MPT assay, and we found that these compounds were toxic to the cell lines. Now the catch came. We wanted to look at normal cell lines. They are toxic to the cancer cell lines, yes, but are they toxic to the normal cell lines? That is also very important to study over here. Unfortunately, we found that the compound 2, which was active against aurora kinase B, was also toxic to the normal cell lines. You had to give at least a 10-fold concentration, but still it was toxic. So that is a compound which we are revisiting now, and we are looking at it. Compound 4 and 3, which were actually specific for aurora kinase A, were toxic, 50 values. All these compounds were actually much better than they inhibited greater inhibitory activity against the cell lines than the reference compound. So here actually I just wanted to show how much time do I have, so I will move accordingly.
Actually, it's a very interesting lecture. I want you to go ahead, but
It's already over. So I'll just skip this one and I will go to this. I just wanted to show how the cavity actually look like. So this is how the compound 2 actually bound to this, and that the other arm actually went inside the cavity because there was space over there. And this was a broad cavity, so the compound 3 bound actually fitted very properly in the binding site. So this is just a view of it. I'll skip this slide because this is a recapitulation of whatever I have said before. So just to summarize, the structure-based drug design was used to generate a compound library, and the funding was by TST, and thank you all for your attention. And apologies for overtaking the time.
Thank you so much, Professor Kaur. So, in fact, I also want to ask questions, but I guess I'll skip that. Now, also open for discussion, questions from students, if any.
Really, it was a very interesting talk. I must congratulate you. You explained it so nicely. One just query is that these, kinases, they are overexpressed now the different type of cancer cells?
Yeah, various cancer cells. They are there in breast, lung, GI tract. Those are the most common ones.
And if you target those, maybe inhibit those, the normal cell also will be inhibited?
No, the whole idea was to inhibit the overexpression of these proteins. So that is why the ADMET property is always calculated. So our aim is to inhibit the overexpression. So normal cell activity would not be inhibited in this case.
I have one question.
Yeah.
One question.
Yeah, sure.
See, these are the signaling molecules,
Yeah.
which themselves are also regulated at a phosphorylation, dephosphorylation. The conundrum is it the overexpression that is the concern, or is it the prior activation of this aurora kinase, which then...
Actually, people have studied the prior activation also, and they have come on to the conclusion that aurora kinase is the one which needs to be inhibited. And there are several studies, there are several molecules which have been actually developed against aurora kinases only. But again, they have never gone beyond the lab stage or beyond phase 1 trial. So there is now one compound which is in phase 2 trial which is called Altasertib. So that has reached phase 2 trials, but that is still to go beyond that. So people are still in the process of developing aurora kinase inhibitors.
Any other question? Specifically from students?
Okay, yeah. Good answer.
A very nice talk, ma'am. In the virtual screening, you have mentioned that you have screened 10 compounds from the 20,000 library. So what?
Boiled down to 10,000.
Yes.
10, yeah.
So what was the criteria? Because molecular docking gives energy, very similar kind of energy for these compounds, and it's always remain challenging to shortlist 10 compound out of from that big library. And even in that case, the structure of the receptor in the molecular docking is taken as rigid structure.
No, what we did not, you can take, you don't have to take it as a rigid structure, you can change that when you do molecular docking. So it also depends upon two things. One is the docking program that you use. So most of our docking is done by two programs, which I have shown. One is by Autodock, which is a freeware, and the other is Schrodinger, where you can have the molecule, your protein as flexible also. So we have used flexible docking in our case. And the criteria for actually boiling down to 10 molecules is not just virtual screening. We have actually looked at the compounds and how they bound to it. And it is more of a crystallographic endeavor over here than a proper computational biology. Because when we do this, we actually look at how it has bound, what are the different bonds which are made, whether it is hydrogen bond or the ligand and protein, the different ligand-protein interactions which are there. So that was also one of the deciding factors.
That means you are looking for the interactions with the key residues of the protein.
Key residues of the protein, yes, and the surrounding residues also.
Thank you.
Thank you so much, Professor Kaur.
Thank you, ma'am.
I would request the chairs to kindly felicitate Professor Puneet Kaur.
सर साथ में वेट थैंक यू
Thank you so much, ma'am. Now I request the chair to kindly introduce our final speaker of the session, Professor Rajat Sandhir.
Yeah. We will skip that. No, I don't think we should skip that. I think it is indeed an honor to have Dr. Rajat. So I think we are very close friends. But I give this honor to Dr. Tandon, who's from...
Walking through the dais very slowly, has received his MSc and PhD in biochemistry from PJMR Chandigarh. He's been part of biochemistry in Punjab University for more than 20 years now. He has 28 years of teaching and research experience. His research interests are to understand the biochemical and molecular mechanisms involved in the development of neurodegenerative conditions like metabolic encephalopathies, dementias, brain injury, with a particular interest to investigate the role of oxidative stress, mitochondrial dysfunctions and alterations in permeability of blood-brain barrier. In addition, his interest is also to identify neuroproteins and has mentored over 3 dozen students for PhD. He has an H index of 49, I-10 of 140. He has been on the editorial of many international journals. He has been awarded with K.T. Shetty Memorial Oration by the Indian Academy of Neurosciences. He has recently been conferred with Mrs. Abida Mehdi Award 2022 by the Indian Academy of Biomedical Sciences for outstanding contribution in the field of neurosciences. He is also Fellow of Indian Academy of Neurosciences and Indian Association of Biomedical Scientists. He is also a recipient of INSA Best Teacher Award 2022. He has been listed among the world's 2% scientists for the year 2020, released now by the Stanford researchers from Punjab University. Before I go out of breath, now I request Professor Rajat.
So very good afternoon to you all. And it's always embarrassing when your friends introduce you. Because they can call you names, they can call you different ways. So I would say I've been in Punjab University for 22 years and I would admit that I've grown along with biophysics. So I was nurtured by senior colleagues from biophysics, and one point of time there was a comment also from one of my chairpersons that we will get you transferred to biophysics. So I feel I am very much part of biophysics department. So it's an honor to come back and share some of the work that we carry out in the department. And my lab focuses on a couple of areas. One of them is dementias. We look at sporadic Alzheimer's disease, how diabetes connects to Alzheimer's disease. We also have an interest in metabolic encephalopathies and Parkinson's disease. So I'll talk about Alzheimer's disease, and Marcus made my life easier. So I'll skip some of the slides in the initial part of my introduction. And this is a cartoon to illustrate what happens with Alzheimer's disease, loss of neurons over a period of time. And this is an illustration to tell you that this is self-portrait of William Potter Mollum from 1967 when he made the first portrait. Look at his portrait in 1996 and look at what happens in 5 years' time. So that's the progressive nature of this disease. And I'll not get into what happens in Alzheimer's disease. Marcus has already explained to us. These are scans of the Alzheimer's brain where you can see atrophy of certain parts of the brain, hippocampus primarily, I would say. And I'd like to talk about this. So Marcus had emphasized on role of cows. So I would say the story of Alzheimer's disease is like the story of blind man feeding the elephant. So you will see people describe it differently. One who holds the tusk, one who holds the tail, one who holds the limbs or the body of the elephant describes in their own ways. So we still don't understand Alzheimer's disease. So whatever we are treating as far as Alzheimer's disease is only the symptoms of the disease. That means we are only targeting cholinergic system, elevating levels of acetylcholine, that's a symptomatic relief. So none of the therapies still are available. It's a complex disease. Age, gender, trauma to the brain can lead predisposing factors. Cardiovascular disease can be there. So 90% of the cases of Alzheimer's disease would be sporadic ones. That means environment, lifestyle, and other factors would contribute to this. So I said we have an interest to connect diabetes and Alzheimer's disease. And if you look at the epidemiology data, there are a lot of studies that indicate that people with type 2 diabetes are predisposed towards Alzheimer's disease. And that is one of the reasons why we sometimes refer to sporadic Alzheimer's disease as type 3 diabetes. And since it is a neurometabolic disorder. And so that means there is some connection between diabetes and Alzheimer's disease. There are other evidences that indicate that. For example, in the interest of time, I will skip some of the slides. For the reason I'm close to lunch, and I know a lot of you would have your glucose levels falling down. So, anti-type 2 diabetic therapies have been seen to be beneficial in preventing Alzheimer's disease. This is a strong evidence that tells you there is some relationship between that. And we see diabetics also show some of the pathological symptoms or hallmarks that we see in diabetes. And so we wanted to see what happens, is insulin playing any role in development of diabetes? And when we wanted to ask this question, we also wanted to know whether the glial cells and the neurons would also have a crosstalk into this into the system. And the model we wanted to use was based on streptozotocin. A lot of people might be working on diabetes, and then we know streptozotocin is the commonly used drug to induce peripheral diabetes. So we wanted to take this streptozotocin into culture system and wanted to see whether we can induce diabetic phenotype or we can model diabetes in culture model. So what we did was we took neuronal cell lines, we took glial cell lines, carried out a mixed culture because we wanted to simulate what happens in vivo where there is a crosstalk between neurons and glial cells. So we have these plates which where you can see the media is being exchanged between glial cells and the neuron cells. So there is a crosstalk and you can expose these cells to streptozotocin in one of the chambers and try to look at these things there. So what you can say is, I will not get into all the data, but you can see when you talk of the streptozotocin treated cells, you can see these aggregates of tau in these cells. You can also see amyloid deposits in these. And what you see is there is inhibition of glucose uptake into these cells. So that means we can see two hallmark findings in these cells. One is the taus or aggregate these helical filaments, which is tauopathies, and we can also see amyloid deposits stained with Congo red, which is one of the commonly used dyes. And we looked at these cells independently also what happens to glucose transporters in these cells. In the interest of time, I will not get into the data. We know this amyloid, one is tau, he said, and tau was emphasized by Marcus in his talk. The other important aspect of Alzheimer's disease is the processing of amyloid precursor protein. The role of this protein still is something we don't fully understand. And we know that this protein gets proteinized to generate fragments, and one of these fragments is a beta peptide. So the molecule from 40 to 42 amino acids, if there is increased level of 42, A beta 42, it leads to pathology. So why there are still a lot of theories about why this 2 amino acid addition changes the protein so much that you see these in the form of extracellular deposits. And there are secretases that would be involved in processing of this amyloid precursor protein to these amyloid beta peptide. So we wanted to see what happens to this processing of amyloid beta peptide in our system also. What we saw, interestingly, was the levels of base 1 amyloid precursor protein were all elevated, indicating that there is amyloidogenesis also in these cells, and that's the reason you see these amyloid deposits in the cells. And we also wanted to see what happens to, there is a pathway called amylogenetic pathway and anti-amyloidogenic pathways. So I will just not get into the data because it's a busy slide. I will just give a message that amyloidogenic pathway or amyloidogenesis is enhanced, whereas anti-amyloidogenic pathway is suppressed in these cells. So we looked at markers of these pathways. ADAM2010 is considered to be one of the anti-amyloidogenic pathway markers, which we looked at using Western blotting and other techniques to show that amyloidogenesis is enhanced in these cells. And then we wanted to look at what happens to insulin signaling in these cells. So in the interest of time, I'll say that we saw insulin signaling, particularly PI3 kinase is getting activated in these cells. And this is the data of PI3 kinase, GSK3 beta, which is one of the mediators in these insulin signaling pathways. So we wanted to see whether we can target this in our system. And this is one part of the study. And then we also modeled this in vivo, took the streptozotocin, injected it into the brains of these animals, and these are behavior data which tells cognitive deficits are there in these animals. Motor functions, no change because we are not changing anything except in the hippocampus. And these are, now you can look at in the brain also, you can see streptozotocin treated animals show these beautiful tangles, which you will appreciate indicates these enhanced formation of tangles, indicating Alzheimer's disease-like pathology in these. And these are Western blots to look at quantitative data of the phosphorylated taus in these brains. And this is, again, we also looked at what happens to spine. And the neurons in these, you can see this is the normal neuron, where you can see beautiful dendrites and the nerve terminals, where you see, in the case of streptozotocin, you can see shrunken, the thin axons, and then there are a number of spines also are reduced, indicating it's creating a pathology where there is changes at the level of neurons also. Immune system is activated. I'll just emphasize on one or two slides just to indicate that if you give streptozotocin, you can see activation of both glial cells and microglia in these. That means this brain is in an inflammatory state. And so the next part of my study, I said that using culture studies, using in vivo model, we could show the pathology in these animals, and we could also show that it is activation of GSK3 beta. So can we think of a strategy to suppress GSK3 beta to emulate what happens in the pathology of Alzheimer's disease? And for this, the first part of the study was published in Molecular Neurobiology, and so this is what I wanted to tell you was that we wanted to target GSK3 beta using siRNA-based gene silencing approach, because we said this is what is activated and can we suppress this. So we used graphene oxide as a matrix for delivering of this siRNA, coupled this with the linkers, PEG, PEIs, and then transfected these into the cells. So and these are characterization of these particles that were prepared, trying to even show that the siRNA was attached to it, and the kind of modifications were also characterized in these particles. And when you're talking about transfecting these, you have to optimize your doses and the ratios in which you have your siRNAs and graphene oxides. This is all validated. You could give a proof of concept that whatever you're saying siRNA is getting into the cells and is being successfully transfected. And so I said you have to validate your siRNA, and what you can show here clearly is the reduction in GSK3 beta when you give siRNA against this GSK3 beta. Whereas scramble RNA, you don't see any change, and this was done both in C6 or the glial cells as well as neuronal cells. And further, we also looked at these APP mRNA. You can see suppression, which was increased in the case of streptozotocin treatment. Same base 1 mRNA was enhanced with streptozotocin. It was suppressed with siRNA. So the culture study is also pointing towards that your siRNA can prevent GSK3 beta activation and reverse the hallmarks that are seen in Alzheimer's disease. And insulin receptor, you can see upregulation of these after we give siRNA against GSK3 beta. BDNF, which is a neurotrophic factor. Any disease pathology, you see BDNF levels go down, and we could see reversal of BDNF, brain-derived nerve growth factor, in these cells, indicating that there is protection offered by the molecule. Gave this. You can see this slide indicates reduction in these neurofibrillary tangles in animals treated with siRNA, again suggesting that, and then Tongo's staining, that is amyloid deposits were reduced in these animals, again pointing that both hallmark findings were suppressed. So I will not get into the rest of the data that tells you about myelination and things like that. So I will, this part of the work was published in ACS Applied Materials and Interface, where we showed that siRNA against DSK3 beta is able to rescue insulin signaling and prevent Alzheimer's disease pathology. And so the carry-home message is streptozotocin induces insulin signaling dysfunctions, and that are believed to be key mediators in spreading Alzheimer's disease pathology, including increased A-beta load, tau hyperphosphorylation, and which is predominantly was seen in hippocampus. So we all believe that glial cells are the silent spectators, or you can say, but now we know they are even playing an important role in Alzheimer's disease, and rather they make the neurons more vulnerable when they are present in the vicinity. And so that means glial response is actually making things worse in the. So, and finally, DSK3 beta knockdown, improved cognitive functions, and other hallmark things as insulin signaling in the brain of these animals, in which the Alzheimer's pathology was induced by streptozotocin. And this is the carry-home message that streptozotocin could induce the pathology, and when we knocked down DSK3 beta, we were able to reverse the pathology of the disease. And finally, I would like to acknowledge the people who are behind the work. Sumiti Gupta was a PhD student who carried out majority of the studies, and the collaborators Dr. Nitin Singhal at NABI and Professor Dinesh at IIT Kanpur, and funding from UGC. And thank you all for your attention.
Thank you so much, Dr. Rajat, for very wonderful and very extensive studies which you have done, and we also know about your achievements already. Just one question before I, let you open for discussion. Like when it comes to treatment of Alzheimer's disease, this particular molecule GSK3 beta, are there?
So, what would be the outcome if this becomes a specific therapy? Is it that GSK3 beta brain specific? If it is so, excellent. But if it is not, then you are already rather allowing GSK beta to be more, so that beta gets degraded. This is one aspect. The next aspect would be the diabetic related Alzheimer, if you are trying to relate that one. Is there any, because this streptozotocin may be an effect on brain rather than affecting the pancreatic or the otherwise metabolic system, which leads to the diabetes. So is it that specific? In that light, have you tried giving more glucose and then see that Alzheimer phenotype is there or not? These are two things.
I will, the first part of your question was, in this DSK3 beta is there in cancer. I would like to say that when we talk of neurodegenerative disorders and cancer, we are contrasting. So what works for cancer will have an opposite effect in case of neurodegeneration. So you have to separate both out when you're treating them. So there you're talking about proliferation, here you're talking about cell loss. So all therapies you look at, what are tried in cancer would actually be useful in neurodegeneration. Only issue is you need to be specific, having localized effects, because you don't want to lose the cells here. You want to save the cells. So, answering your question, I would say the nasal delivery, or you could have even better delivery mechanisms so that you're able to deliver it to specific cells and cell types or even regions, and there are people coming up with strategies to do that. Second part of the question is streptozotocin and pancreas. So what we did was, I did not emphasize in the interest of time, we were giving streptozotocin only to the brain at very, very low concentrations. I didn't show the data, the plasma insulin levels, and plasma glucose levels both were normal in these animals. So nothing happened to their peripheral system. So a lot of people have done studies where they have made peripheral diabetes and then looked at brain, but then all of the tissues are affected. So we wanted to dissect that out by injecting streptozotocin, and one dose, 21 days, this is what you see in the pathology. So and the concentrations is micromolar concentrations, very low concentration, one dose.
So you did investigations after 21 days?
21 days.
If you prolong maybe up to say 40 days or maybe 50 days, then what you assume, what will be? Maybe there is nothing. I think so.
So you were saying pathology may be clear?
Pathology will not be there if you delay up to 2 months after the administration.
So you're saying the effects of streptozotocin could be reversible?
Yes.
Could be reversible. I don't want to comment on that. I don't want to comment on that unless I've done it. But intuitively I will say something different.
Okay.
That rats and humans are very different in many ways. You do a spinal cord injury in a rat, it recovers, you will see BPP scores all coming back. After some time, humans it will never come back. So saying things, I cannot say predict things intuitively because biology is very different.
But maybe you tried.
Or it could be worse also. It could be worse that it's the. See, I would, if I have to answer your question, I think clearance of plaques and tangles would be very difficult.
Maybe do it in 2 different groups then.
Yeah. And brain is plastic also, so I don't know what to say in this. So we wanted to look at a window where you see the pathology.
There are questions from faculty students.
So, regarding your siRNA, so how did you optimize the sequence?
So, regarding the sequence and the type of nucleotide you are trying to work with, did you try doing selects or something?
So I would say that we did not go for selects, but we picked up 5 or 6 sequences. We tested sequences and got to the best sequence, optimized the dose. Even the ratios in which you have to mix these, linked with the graphene oxide. So all these optimization, bindings and everything was done. So 5 or 6 sequences were picked up to start with.
So that's
one of the sequences I showed you.
So because Nitin has expertise, so probably selects can give you better data.
Selects is expensive also. That's something you have to go with something cheaper also. So selects will be time consuming and yes.
Yes, more question please. Though we can, all feel aroma of this will be.
Yes.
It's a very nice talk. So in the starting you have mentioned that you have used insulin and A beta because Alzheimer and type 2 diabetes are interrelated. And you use some cell line and then injected into mice, I think for in vivo studies. So what was the conclusion, like how it get affected, that insulin, like how insulin affected Alzheimer disease or A beta affected type 2 diabetes?
So what I am trying to give you a carry-home message is that if you go to the history of neuroscience, we have always believed insulin has nothing to do with brain. Now we know there are a good amount of insulin present in that, and insulin signaling is very important in key functions of the brain. And some of the insulin is being synthesized in the brain also. So what I am trying to give you a message here is that this insulin signaling, if it is impaired, would leads towards pathology that is seen in Alzheimer's disease. And I would say this is established now, the connection between diabetes and Alzheimer's disease, and then hence the term this type 3 diabetes we are saying. Did I answer your question?
Yeah, yes, okay. Thank you, sir.
So a lot of epidemiology data is available on that to indicate that.
Okay.
Thank you so much, Dr. Rajat. Thank you.
Thank you, sir, for such an elaborate and detailed presentation. So now I request the chair to kindly present a token of appreciation to Professor Rajat Sandeep.
पूरे ब्लॉग ना पूरे ब्लॉग सर प्लीज चले जाओ उधर चले जाओ फ्रंट पे चलो और पीछे आ जाओ। ठीक है सर।
Thank you so much, sir. So I guess with this, we have now come to an end of session 5. Now I request Dr. Pavitra Ranawat and Dr. Tanzir Kaur to kindly come forward and felicitate our session chairs, Professor Sanjeev Puri and Professor Chandradeep Tandon.
ਉੱਥੇ ਰਹੋ यार। नाउस सुन लिया करो, नाउस की कर रहे हैं।
Thank you so much. Now I request everyone to kindly proceed for lunch. The final session of RTBT 2023 will commence at 2 p.m. Before coming back here at 2 p.m., everyone is requested to kindly gather outside for a group photograph. Before lunch, we are gathering for the group photograph in the dining hall itself, please. We'll do it quickly.
बाहर हो नहीं सकते, बाहर बारिश पड़ रही है।
I hope he's fine now. One in India.
इसके लिए भूख लग रही है।
हेलो हेलो एक काम जी लाइव बंद कर दो। हाँ लाइन टाइम स्टॉप कर दो, लाइन टाइम हो गया। 10 दिन में कैमरा बंद करना है। हाँ ठीक।
Hello, am I audible? So thank you very much for having me here, and then I welcome you all to this session, which is on women in science. And I think before we start the session, I think we need to all clap for ourselves. Women in science. Yes. So this is going to energize everybody after the sumptuous food that you have. And so today, not taking much time, so I would want to invite our first speaker of the session, that is Dr. Shalmoli Bhattacharya, award in New Biology by Indian Science Congress. And she got membership of National Academy of Medical Sciences India. She is also fellow of International Society of Biotechnology, and also been awarded Certificate of Distinction for her high quality research on Annual Research Day by PGI, and that is for consecutive 4 years. And that's great. And also she is mentored in Newton Bhabha Fellowship Program for early career researchers in India and UK. And she has also received Certificate of Distinction for oral presentation in the second Medical Olympiad in Greece. And other than that, this list is long. So it's long.
Thank you for this elaborate introduction.
I know it's a little but I will now invite you to deliver your talk on the title, which is Exploring the Regenerative Potential of Human Mesenchymal Stem Cells in Calvarian and Segmental Bone Damage. Please.
Thank you, ma'am. And it's always a pleasure to be back. So this is the place where I started my academic career as well as my employment career. So I did my MSc from PhD from PGI, then I came back here as a lecturer, then I went back to PGI as an assistant professor. So I have been moving across the road for a long time. So, and I thank Dr. Naveen and Dr. Avneet and all my teachers for inviting me here back for this session. So I'll be talking, and this work is mainly by my PhD students, Dr. Shalini and Aditi, who soon will be finishing her PhD. So this is, as ma'am said, is on exploring the regenerative potential of human mesenchymal stem cells.
Dr. Shalini, just excuse me for interrupting. So because we are a little late, so I would want the talk to be very crisp so that the students can have some time to interact.
I will finish in time.
Thank you very much. Please go ahead.
Not many slides are there. Anyway, so coming to the concept of regeneration. So I'll just recall the story. So this is basically a mythology. In Greek mythology, there are references to the concept of organ regeneration. So Zeus was the god of universe considered, and his son Prometheus, he stole fire from gods to give it to the mankind. So Zeus punished him. He knew it to be the most painful and torturous form of punishment because the person is not dying but is suffering. So again, there comes the concept that they knew about this concept of regeneration, organ regeneration. So today in the modern world, we are looking at the organ on chips. We're trying to regenerate the organ. We're trying to, the regenerative medicine in different fields have come up in a big way. So this has its origin to the ancient literature also. So it is not something new. So the main movers in the case of regenerative medicines are the mesenchymal stem cells. So these are the cells. So we all know the human body starts with stem cells. The embryo consists of stem cells. But during the course of maturity, the stem cells are lost, these are differentiated. But in an adult, the stem cells, minor population of stem cells persists because they are in the process, they are required by nature, they are provided by the nature because they are required for the regular repair and regeneration of the organs. So the wear and tear is mainly taken care of by the stem cells that are hidden inside each organ. So now we are at the science has come to that level that we can now take them out, proliferate them in vitro and use it for therapeutic purposes. So coming to the bone defect. So my area is on the bone defect. Presently I am working on that area. So we all know that bone doesn't need actually regeneration because it has its self-healing properties. All of you, many of you must have faced fractures or small cracks, so which have regenerated by themselves. It didn't need any interventions. But in case of bone defects, maybe because of trauma, congenital abnormality or cancers, so when the defect size it increases the critical size, it needs some interventions. So otherwise it causes even methods to accelerate or fix these bone damages. So that is what we've been working on with these students. So different strategies which are now available are the bone grafting. So this has been going on for a long time in the clinical practices. You have autografts, allografts,
Now you have the various bone graft substitutes, ceramics, and so many of you might have gone an accident with, or anybody known to you. So you had to be implanted with some plates or some ceramic biomaterial or scaffolds to kind of support the process of healing. So now we have many methods for cell-based bone regeneration, which is more natural form of the regeneration. So here comes the role of the mesenchymal stem cells. So these cells are used either alone or along with some kind of suitable scaffolds. So designing of the scaffolds is again becoming a very interesting area of research. So these are some of the models. Now normally rodents are the gold standard, then larger animals like dog, sheep, goat, pig are also used as bone defect models. However, they have certain limitations, like their structure, bone metabolism, that is different from the human system. So sometimes they do not actually replicate the actual defect and its repairs. And again, in small animals, it is very difficult to find the pins and fix the bones. Then survival surgery is also difficult in case of animals. So again, the in vivo testing raises concern of ethical, like we have a very strong animal ethics committee, so we're not allowed many animals for the group. So there's always a fight to have the animals. So the other model are the ex vivo models. So these are more natural or more near to the natural healing process of the human. So here what we do is we take either long limb bone or femur head or Calvarian bone which we culture. So in this study we have taken femur bone and we have done the culture. So these are the two defect models which we have worked on. One is the Calvarian defect and other is the segmental bone defect. So Calvarian bone is basically it has the osteochondral ossification process. So and the segmental bones are mainly for the load-bearing bone. So the process of healing or the process of regeneration that has to be designed for both the bones are different. Because Calvarian is more of a protective bone, whereas segmental bone defects are more of a load-bearing kind. So these are the different types. The gold standard for using of the stem cells are the bone marrow. So we know that the bone marrow derived stem cells or the BMSCs are in therapeutic use. They are used for leukemia studies and all kinds of blood disorders. So this is a standard clinically approved method of using the bone marrow, the mesenchymal stem cells. But in case of regenerative medicines, they have many side effects like infection, injury. It's an invasive process. So people are coming up with other sources, and we have focused mainly on the adipose-derived and the dental pulp-derived stem cells for our studies. So this is a general protocol of isolation of the MSCs. So this we have done with Dr. Vidyarathan from Oral Health Sciences, and the adipose we have done with Dr. Siddhartha and Dr. Aditya Agarwal from Department of Pediatrics. So they have provided us with the samples. We have done the primary culture. So these are the three, once we have the cultured cells, we want to know whether they are actually MSCs or not. So these are the ICSC or International Commission of Stem Cell Research. They have this criteria, that is adherence to the plastic surface. These are the set of positive and negative markers that has to be expressed by those cells, and they should have a multipotent differentiation potential. So before going to the actual study, we need to characterize whether the cells we got are from the actually MSCs or not. So this we have done an explant method of isolation of the, I was talking about the DPSs, that is dental pulp derived stem cells. So this is the plastic adherence, then we have CD73, CD105, negativity for CD45 and 34, and CD45 and 34 are the hematopoietic stem cells. So this is the protocol. So, and for the it was 24 days, and for the protocol. So after the end of the induction of the differentiation, mineralization, where we see that there is the uninduced didn't show any. Again, action to which identifications. find the positive. Therefore, the population of cells. Okay, this is another. We did the neurogenic differentiation for identical sepsis. Shokubin found that difference in the specific differentiation potential. We found that these were robust cells and could be used even after. So, compared to the monolayer, because monolayer is culture system. How actually reciprocal condition. So what is sense now that the regeneration. So this was a and form of monolayer as well as in sphere. Took out the animals were sacrificed. See that there was a better compared to the defective, and again steroids show better ossification. So this was the histology of monolayer versus the spheroidal scoring. Then this showed that the spheroids, they had a better extent of ossification. It was used as also has some osteoinductive and osteoconductive. We could say that it's better the mesenchymal cells during clinical transplantation in a 3D platform rather than in a into a ex vivo model. Because in case of segmental defect, we tried it in rabbits, very successful for replacement. So this was our protocol. This is again, since this part of the study was done in adipose derived. This is again the characterization part to say that whatever we have derived, we have isolated from the patient. These are plastic adherence. This is the flow cytometric typing, and this is the differentiation potential. Next comes for load bearing scaffold. Load bearing first supported by a scaffold, then once the region activity can be taken up by the newly formed bone for bone region. By our colleagues in the orthopedics. So this was an aqueous paste of powder. So these were all taken commercially. The data sheet. Nothing about actually synthesizing biocompatible scaffolds. So here we have actually. So one thing we want to look at was whether these scaffolds are support, because in clinical practice the scaffolds, they themselves has an osteoinductive effect. So the of the scaffold itself. So unless the cells adhere to analyze So we did SEM for this and we found sulfate and HAP block. They showed the adherence of the MSCs, which did the ADCs with the scaffold for 24 hours and did this image. Then HAP block, then we did a further study to see that how and what is the cells. So we found they are shown day 7. They were happily proliferating. So we decided to use rest of the so this water drop on 45 days, we could see that is visible. We looked at region. This is again more in the sense where scaffold plus ADACs are there. The ostrich scene expression with ADACs is there. Then collagen and these were IDACs along with for addition was increased expression accelerating the process of regeneration. Again, checked and then decrease after 45 days. So this again was better in case where the HAP plus ADACs were added. So next we did a micro-CT evaluation of the bone region. And basically this is the quantitative assessment. So the bone volume was better, the bone surface structure was improved. So the bone volume ratio was also better in case where HAP was diameter. So in 45 days we have seen that when AD is having a better density is also better, trabecular number, trabecular thickness is improved. Is what we require. The mean density is increased. So improved microarchitecture of the bone formation is there compared to what is normally used. So have while we add MSCs to them, accelerating the bone growth. We have proven the concept that MSCs can accelerate both calcareal bone damage as well as the segmental bone damage. So along with the osteoendocrine MSCs, we can improve the quality of the bone that is. So I'd like to acknowledge Professor Agarwal, Sajjan Tala, ICMRN. So thank you. I think I have finished in time.
Yeah, thank you so much for that. And people who have a very quick question, maybe if have one or two questions, quick questions. It's a wonderful talk that she has presented. Congratulations for that. Very good work, and it's going to be a translational work, so obviously it has a lot of immense value that.
And run around and sign and things.
I know, but the leadership always counts. So, any questions, please? Maybe I can just have one quick question that, when we talk about induced DSCs, so in the mesenchymal cells, so वहाँ पे जो problem है safety issues, teratomas, okay.
Because these have already been in the adult niche, and induced pluripotent are totally embryonic. During embryogenesis, even the small stimulation can result in risks with the cell base. So now, so that is another.
All the best to you for your future endeavors. Thank you very much.
ma'am, for this fascinating lecture. Now I humbly felicitate Professor.
Yes, ma'am. Please. Thank you.
Ma'am. Now I request the chair to kindly introduce Monica Sharma.
Okay, so moving on to the next talk is by Dr. Monica Sharma, and Dr. Monica, an assistant professor and a founding faculty at Lashkar University. And she is, prior to joining this university, she was an inspired faculty member at ISER Mohali, and she natural science from IIIT Hyderabad and has 2 postdoctoral stints, one at the Michigan State and also the DART Fellowship at Max Planck. And she has research background in developing computational tools and techniques for analyzing biological systems. And she has a lot of application through.
Thank you so much for the kind introduction. Let me just fix it up.
I'll also request you to be keeping the time.
Sure.
Thank you.
I'll try my best.
Thank you. Okay, I'll do that.
Okay. So I'm Dr. Monica Sharma, and today I am a computational biologist, and I would like to say I think now it's fine.
Whichever way it works.
Okay, so basically I try to do computational. We try to do is that we try to actually bridge the larger scale biological phenomena with the macromolecular dynamics. And here I approaches I have done till now. So it's an E. coli, but for me this is what E. coli looks like. So there are so many networks which, so it's much more a complex thing, though it's a smaller thing. I'm going to just talk about digestion part. So as we have E. coli, they sugar acids, right? We don't need sugar acids. We are, so they take it from the gut and then they strike there. So that is why right? That we try to look at. Rashna. So she is expert in microbiology and she is the one who found the transcription repressor which actually is involving sugar acid. So what they found was an opron. I hope everybody here knows because in this opron from activation or repression mechanism which is induced with it, right? And this is DCR opron. It specifically consists of, so you have, and you have
have a DCR. So there is every bacterial actually kind of utilize all the. So this is the one pathway which is specifically with respect to the DCR. That's why it's decollected overall, and now you have a DCR. Now in this case, so you have a plate. Now in all this, you want to see that which component is going to tell that it is going to grow in absence of decollecting it. Right? In glucose, you see everything grows. Now when in other case, it seems that the DCR is the one which is going to be negatively the metabolism decollecting it. Right? So what does that mean? In absence of decollecting it, the DCR protein is going to keep bound. It is not going to let it go. Right? If it is not going to let it go, then the downstream is not going to happen. So the video was the first time that this DCR was identified in the lab. Likewise, it was being done, and then what happened is that everybody who found something, let's try mutagenesis. Let's see how it is going to behave. What are the mutants that are going to be there, so that you can design things, you can design more experiments, right? Mutagenesis was designed. In a sense, so what you want to look at the gene, which is this one, LDLS. Now what happened is that so you see this is knocked down, so this cannot go down, right? So now you have a phosphorylated intermediate accumulated. Now what will happen if you have a phosphorylated intermediate? There won't be any energy with the TC cycle, the organism is going to die. That's a simple thing. Okay, so the first thing is intuition. This intuition is always, is execution, which is we try to look at what are the different mutants which are going to be there, and likewise mutagenesis from. So they were the super repressors. Now, then the question can is going to take like lots and lots of time, lots and lots of money that is going to be there. Now this is where your computational biology can help you a lot. Now which ones we should follow? Said, okay, you have what you have in your rate of mutagenesis. Let's look at the structure. But we didn't have a structure at that point. So what we identified was, let's look at the unrooted tree of the GNTR family. Now in this case, luckily, DGR. So this is your DGR. That means it's close to GTM. Now comes your technique, homology modeling. Now when you know, whether we know the structure of the other similar protein. Okay, so we have FADA, and happily we got a function structure for a FADA. Now FADA and DGR, they only get the, let's say the sequence %, which is not that great. Unless until 85% you can say exactly it is going to match. But 30 to 35% is doable, but not a very great sequence homology that we think about. So the thing was that let's try a model for that. Okay. Wrong, that is your N-terminal which binds to the DNA, and that is your DNA model. Then that we try to do in a sense that just try to look which of the amino acids. First of all, in our first study, we just try to look at which are the things. So you take a subset of plus you get in a random mutagenesis. Now you see both of the checkbox where are checked. So when you are going to work for it, then you can do other experiments. You can do advanced experiments to look for that. So that reduces the complementarity that the experiments and the computation. Computation, if I say, of course, I can get the answers. For example, I said not only within 18 residues that they are important. Out of 18, 8 were validated. they were taken up for the mode experiments. Okay, so that was our first, and this is the fluorescence look for all the mutants that they generated based on their computation screens. Okay, so going forward, that whenever you see a structure like this, the question that arises that come was in the C ligand binding domain. Here, right? The DNA is bound in your N-terminal domain, and distance is about 50 angstrom, which is a very large distance. So how 50 angstrom along is to the N-terminal down and results in a DNA. So now to look at this allostatic regulation, because then we can look at, and particularly we were isolates because we knew that if there is a mutation in let's say a ligand binding domain, of course it is directly interacting with it. What about the mutations which were nearby but not in contact with the ligand? So those mutations, and we try to look further that why it is happening, what's the reason for this allostatic regulation that is happening. Second, and then you're done. Okay, so these were the genetic variants, 4 of them which are available or we identified, and then we tried to do the modeling part for that. And these we look include for these mutants when even at the higher D-galactonate concentrations. Okay, so that's the fundamental part. Now moving further with our computational biology, or let's say computation modeling part. So first, the modeling requires various steps of refinement. Everybody say now we have got AlphaFold. Go for it. It's not that. If you are a hardcore modeler, you know that AlphaFold also gives you only maximum 45% of go ahead with the structure is fine. But when you go to a modeler or a person who is expert in a structure, they will see what the problem is there, right? And I must tell you that when the first paper was published, there was no structure for it. Afterwards, there was a C-terminal structure done only with the ligand side. There was no N-terminal, there was no nucleic acid, just a small portion of a domain, right? C-terminal domain. Because the action structure is sacrosanct, we can't touch it. We have to utilize those coordinates and create our model. And then you attach an N-terminal, so this has been modeled by data. So our thing was, with the model part. Let's try with the AlphaFold 2. AlphaFold also gives you this thing. The only problem with AlphaFold is that it is going to give you monomer. Know where the link would be, because unless and until you force to people, or let's say force to, you don't know how they are. So the second part we did, we put a and then the IR, which is an inverted repeat DNA model. Talked with the ligand part, and then you put what? You put it in a solvent. Once you put in a solvent, you need to neutralize it also, because that's where your the molecular dynamic simulation. Boundary conditions, now you have the system set. So you do what? You then do a simulation and you try to validate based on that. Okay, so all the steps I have done. So how many simulations were done? So there were 4 genetic screens, 4 so total of 9 systems, and then we did both in presence of ligand and absence of ligand. Right, each amounting to microseconds. So that's a lots of data to work with. And for the people who doesn't know how molecular dynamics work, I assume everybody should know because you have physics. Saying it again and again because I am thinking that this is a forum where whatsoever I am going to speak, you guys will be. Okay? So molecular dynamic simulations, what you do is like doing the same experiment which you do in vitro, you are going to do in computer. In vitro, you are going to set up your sample, you are going to equilibrate, you are going to then look at the property average, right? So that's what we do in Lysine labo switch to one of my studies as well. So you take it, you put it, create a system. Now you have the n number of atoms. I'm going to start boundary condition that this is how I want it to be. physical rules, how the atoms are going to attract or repel each other. Okay, you need a formula for that. Potential, your van der Waals interactions, right? So which you learn in the physics get applied here. Now once you have it, we are going to integrate. Now you have an integration done. Okay, so once you have done, you are going to do what? You are going to look at the results. Now I am not going to bore you with so many lines because there are so many of lines, and all the lines will tell you there is so much of noise in a dynamic structure than the signal. So all you need to do is look at all the data or the statistics technique here to get your higher signal part, right? So here the 5 lines are mean square deviation. What it actually does is tell you how the structure over the time is going to change from the previous one. Root of the mean of the square of the deviation. Fluctuation. So this is with respect to per residue average over the time. Okay? Okay, so once you have it, so now you have lots and lots of things here. Now we want to look at the more advanced study because you see that can give you an idea, okay, how you want to work into the intricate details for it. Now you have what we call as dynamic cross-correlation maps. Now what does that mean? That means you want to look at the structure or the whole as this, let's say the whole of this hall, and I'm going to look at how one corner is going to correlate with another. And then how I'm going to look at the video is going to go out whether the other person also go or not. So the correlation dynamics of it. So this is what I want to look at it. So this gets out that, the previous correlation. So what can be the things at all? That means both of them are anti-correlated, one in opposite direction, right? So you have 3 types of correlation. So that is what the scale says here. -1 is anti-correlated, and blue is going to be in +1, which is blue, is going to be positive correlated, and 0 is something no correlation at all. Okay? Now you see it looks like a beautiful blue and red color. Now the main thing which we try to look at is look at the model. Look at, so the green, so the annotation bars which are here, the green is your terminal of one chain, and then is the N terminal and C terminal monomer, right? So I'm going to look at both. Now the first part I'm going to look at it is how the N terminal of one chain is going to interact with the N terminal of one chain. How the C terminal of one is going to interact with the C terminal of another chain. They are going to interact with each other. There are various modules. I can convert the whole protein into a modular thing. And now when I look at it, so I see there are differences occur. And now you see in M188I, which is not at all inducible, the structure is very, very sparse. If you look at the matrix, it's a very sparse matrix, right? In the other part, not there, Negan free is not there, and when it is bound with the legal right? Okay, so moving forward. Okay, so the advanced technique that we have, we call it principal component analysis. This is, we use linearity reduction. So whosoever has got introduction, they must know that whenever you have data which is higher in dimension, more than 3, 4, 5, 6, you want to get the dimension which makes sense to you without losing the context of the data. So we call it as principal component analysis. It's a way of getting out the, or let's say if I try to say in a more of a dynamics of the molecule, it is trying to getting out low frequency or the high frequency modes which are noise. Now you have only signal to you. Now once you have a signal, you can look happening in the protein, right? Instead of all the jiggling that is you are going to see in the dynamics, now you can look at the smooth motion of a component. You see the difference in the dynamics. So this is the N-terminal domain. So it's kind of a, showing the screw motion, and in this case you just have a kind of a tilting motion that is going to happen. So the screw motion, the intensity is higher in the first domain. So that means it is easier to DNA which is bound to it. And that is what we see when the DNA is bound, or let's say, sorry, when the it is bound in the C terminal domain, this should go out, right? So this is what we see in the dynamic system. So similarly, we look for the other two of them, A90. Is its trauma. Okay, so that was the other aspects. The third was the network analysis. Component analysis and the dynamic cross correlation. We know one part is going to be correlated with another part. Okay, so can we create a network? Each entity is a node, and then kind of. So it's the same network that to the protein structure. Wild type. So I see that this is how. Okay, so that's a lot of. You'll say that that's a lot of chaotic thing that is happening. Now you see lots and lots of, I'll say dark color, light color, and what does that mean? Okay, so here also this is weighted by correlation. That means this part is more correlated, which is a thicker one, and the thinner one are. So that is what we see. Now can we make it more better?
So Dr. Monica, sorry to interrupt.
Yeah, just 2 seconds.
No problem, please. I just wanted to remind you.
Oh, this is done. This is last one.
Right.
So the other part is to actually convert into community. It's like a graph. Let's say you have an area graph. So you have Rajasthan, you have Madhya Pradesh, you have everything. So now that is going to be depend. All the people who are going to be Madhya Pradesh, they are going to form one community. So when we don't have, let's say, the number is these much. You see, in the first from the nucleic acid and protein as well, right? And when you go further, the communities are going to. Now, what happens when the ligand is present? Is when you try to look at, so you see, when you have a community, has gone out for the community with the protein. So that means when the ligand is present, it is going to induce the nucleic acid. That is what our computation studies show, that we can also decipher various mutants. That okay, you can try if we can see the similar effect there. So that means. So similarly with the others. Now I'm just going to stop with the take-home message. I have not told the whole story. Give you the flavor physics can do. So you have nature, everybody knows about it. Lots of functional information. If we can look at or create, let's say, the kind of move. Or as a ritual for how we define community. Okay, so what we do is that when we have created, we do is that we try to move edges from one by one. So wherever the edges, let's say creating, there. Yes. Yes. So then it will be forming. That depends. Only proteins, RNA, only nucleic acids, protein, DNA, or only DNA, and also the fact we want to do enhanced dynamics.
Right.
Yes.
So with that, I would like to talk, and we have lots of students, and they must have understood the power of computational. This kind of
Thank you so much.
To kindly felicitate Dr. Monica with the token of appreciation.
Wait.
Thank you, ma'am. Yes, Mr.
By Dr. Sunishta. Her PhD from Molecular Biophysics Unit of Indian Institute of Science, Bangalore, and she joined as a scientist at the Institute of Nanoscience and Technology, Mohali in 2014. And understanding the biomolecule entitled as Insights into the Biogenesis of a Prokaryotic Organelle from Salmonella. Please, ma'am.
For such an elaborate introduction, and thank you for being here. And insights into the biogenesis of a prokaryotic organelle reaction, and by that the machine activities like as very advanced human being, our brain for some stomach, our heart, liver, so that it can efficiently swim through some variations under which if compartmentalization was not there, it would have survived. I would also like to thank the organizers for bringing me here at INST and this prokaryotic not, although it started almost 50 years back, but when it started, I move away from the mic. Am I audible? So it was discovered 50 micrographs of bacteria. Some very interesting and what everybody thought was these are viruses that almost for field was not advancing. Everybody thought that okay, like there are so okay. Do I need this or I was okay earlier? I need it. But what happened with the advent of time and with the advent of visualized bacteria and development of several biochemical assays in the last century, found out that these helps the bacteria in certain conditions which are not normal. And the reason I into the of your conference 30 years. This is a microcompartment. Look at the first initial ones during 1950, where people the year in the decade of 2000 to 2010, where we started understanding the structure of this. The next one or two slides again. And what is the focus of my lab is we are working on the analysis of this microcompartment to understand how these microcompartments. That if we want to intervene, we can target that. Also, we want to have as nanofactories to use them as in vitro nanobioreactors for biofuel production. Alternative strategies for salmonella management, not only the endemic salmonella but the other salmonella which is more severe, and also involve a huge number of homo as well as hetero. in the next few slides, you will come to see that how complex and how simple the microcompartment is at the same time. So this can be used in protein self-assembly. Okay. So coming to the microcompartment, we see that the microcompartment is of catabolic. They are also of two types, catabolosomes and anabolosomes. Have a very station. So whatever these microcompartments help to fix them, and also of my research as well. And these metabolosomes help. This is a general representation of our operon, which the like we have the shell proteins which make up the outer shell of the microcompartment, enzymes, and also proteins, transporter proteins, skeletal proteins. Overall, so this is a polyhedral structure. It is not a regular polyhedral. It is not a regular. It's a distorted polyhedral kind of structure, which is made up of the green or the cyan color you see inside are the enzymes. The other type of hexagonal proteins that make up the faces. The central and the substrates to come in and go out. Enzyme cluster. Enzymes only have any enzyme getting inside. Enzyme only. And these enzymes are targeted or localized. Important to us have dietary sugar intake. Now, and one of the, in propanaldehyde is produced in an open environment. It does the DNA. Mark the that to high so that it can survive survival strategies. So simple, they are smart. Now this is the operon structure, and I thank Monica for information. We have has a very side other role to play. So this is a simple thermal screening assay. Here we can see that the microcompartment, you can see it is heated. It first baseline and then it starts opening up and then it aggregates. Doing it with the major individual components, and we saw that the enzyme is at a lower temperature compared to the compartment. Next we start PDU-A. PDU-A has a melting temperature close to that of the intact microcompartment. PDU-B, similar holding profile, but it has a and when we actually overexpress these proteins and saw their compartment, you see their sheets or cubes, and when we overexpress aggregate, was that the shell is giving some sort of a stability to the encapsulated enzyme. To look into it, individual shell protein, and we try to explain why this is so. Extra stability to the enzyme, like okay, if the stability is only physical or also functional, and see enzyme PDU-CDE, that's the diol dehydratase, and this is the stability curve, the thermal stability curve of the encapsulation, and you see a 12 to 15 degree thermal advantage. Now this gave us the idea and use this, which which are not doing. It was to understand, was giving the and we started microcompartment, and you can see that the PDU-B has the maximum contribution in the shell. So we started with PDU-CDE, which is the major enzyme, and what we saw was this folding profile of PDU-CDE. When you add PDU, you see that the suggesting that PDU-B is acting as a chaperone or is helping PDU-CDE not to unfold under thermal stress. We did the similar experiments with the specific activity, and we along with PDU-CDE could retain a little bit of thermal centigrade, which is very unusual. PDU-CDE was not 50 degrees lower temperatures. Had a significantly higher activity enzyme. We did the binding assay with a and we found that these the dissociation high nanomolar range, indicating that the EM images of the proteins show that the PDU-CDE was decorated as nano over the sheet of PDU-B. Okay, so two proteins, PDU-B and PDU-B prime, which has a different start codon, but they always together and they remain together. Now we started seeing that how PDU or PDU-B, like the combination of PDU-B prime became, because the bacterial microcompartment you earlier nanofactory, and it is very highly packed. So it was the biogenesis of such a organelle to see how it works in a crowded environment, and we saw physiological conditions of crowding and ionic stress, the PDU droplets which fuse together. You can see it over here. And physiological factors like magnesium ions, specifically the metal ions, affect the association of the protein. And we saw that the magnesium ion actually has a huge. Here you can see that we have done the assay and the purified microcompartment assay. Well, we don't add any magnesium, there is no activity. But suggesting components are formed in the assemble to form the purified microcompartment. So here in the crude you see that with the increase in the activity, but at zero you have activity. But in the purified microcompartment you have at 0 millimolar no activity. Once you purify, you see activity. We did the retro using by adding EDTA, and you can see that in the 0 millimolar you have the maximum TM, and we add the EDTA. And we found out that there are several magnesium binding sites in prime, and when you the magnesium, you see that there is a significant reduction in the activity of the. That magnesium indeed has a very crucial role in the assembly of the microcompartment. That we try to understand the concentration of magnesium and the crowding agent, which leads to the successful assembly of. And we found we have 5% weight by weight, which crowding, and 0.1 millimolar to 1 millimolar magnesium phase separation. The initial the addition of the enzyme, that whether the enzyme is prime. What we saw that when you actually have only the enzyme in and PEG, liquid-liquid phase separation of the enzyme at a much higher concentration. Mix both of them. When you mix both of them, you see that the phase separation occurs, but if you remove the magnesium, the phase separation doesn't occur. And also what you see, why this is so, to explain why the phase separation of PDU-BB prime is much more potent than that of the PDU-CDE, we did some binding assay, and we saw that when PDU-BB prime interacts with PDU-BB interaction, there is no dissociation. CDE interacts with PDU-CDE, there is a dissociation, and that is why you liquid phase enzyme, and this actually shows.
I have to interrupt you because
Okay,
we are running
how
out
much
of time. So as quickly,
okay, fine. Okay, you have an enhanced enzyme activity compared to the free enzyme alone. Some of the control assays where we use the components of that PDU-BB rather than using the shell proteins, and also we showed that there is an alteration due to this phase separation, which is very important for the activity of the enzyme as well as the integrity of the shell. And in a nutshell, what we showed was these are the shell proteins and these are the enzymes. Physiological trigger inside the bacteria, there is an initial self-assembly which is finally out from the mature microcompartment. And with this, I would thank all the funding agencies, RTBT and Nano Mission for, and indeed I thank my lab. We are not compartmentalized. Thank you.
Because paucity of time, so I will not be able to allow questions, but I would want to thank you very much. This is a very, very important talk. And there are a lot of compartments, and as a microbiologist I can see them, but definitely again some other platform to discuss those. Thank you very much.
Thank you so much, ma'am. Now I request the chair to kindly felicitate.
Okay, sorry. Please, thank you.
हाँ जी मैम, look at.
Yes.
Thank you.
With this, we are the chair 2023, Dr. Mita.
Finish it on time because we are running late and already the validation function has to be started. So I'll just PhD at the Cambridge University, UK, and then she stayed there for 3 more years to work in a space. She is a lead cellular and indigenization of diagnostic program, that is index. And
thank you so much, and thank you committee for having me here. So,
yes. You can lay sure. You're here for a long place.
So I think here we switch here. I think is about what we probably don't want to remember is how and how important as a country it was to build on capabilities and diagnostics. So that's the story. I was fortunate to be a part of it. I'll run through it as quickly as possible. So this is the program. It's called Indigenization of Diagnostics. It's a part of Atmanirbhar initiative from the government and how we can become self-reliant and capable and have the right products, specifically focusing into diagnostics for this particular initiative. Very generously funded by the Rockefeller Foundation. Response to the COVID-19 pandemic. So this is where the program was hosted. I think most of us will be very familiar. It's an initiative of DBT and researchers and handholds and has lot of kind of entrepreneurship initiatives working in something that we all talked about. Now if you all want to so suddenly. So it was tested, if you remember, and it was test as many of us as possible. The challenge was that we did not have adequate supply. We are totally dependent on imports from many countries like China, context. So what was our vision? The vision was how do we become self-reliant and very quickly, and how can we enable per day in terms of using indigenous and the huge capacity in the country. So and what was we had developed can complete the entire cycle and bring products to the market. So as I said, one of them was to set up very quickly the centers of excellence, selecting the countries across the country. We knew that certain academic institutes and certain laboratories had the right kind of infrastructure and capability to give support to the molecular diagnostic startups and MSMEs. That was the one way we quickly brought us together. So we set up several later in the presentation. So the other thing, like in India, we often don't know like who are the materials. And suppose I am a kit manufacturer. quality enzyme. But I really don't know my partner for it. So that's why we very quickly set up a system together. So it was like who were making hardware, software, 2 kits, 2 reagents, 2 enzymes. So each other, we can have academic. So who have developed, say, a lab, but they can only develop till proof of concept. After that, partner. So again, look at the whole landscape here. Your biology, and then we had support. But even if I develop a product, where do I do my clinical trials? Informatics, business will arise for both. This was supporting actually there. So what did we do first? If you know, like, great reagents, right? And most of us, we are not very happy using the indigenous materials because we always have some mistrust with the quality. So what we did is diagnostic to need a next level bar of quality. If you are doing your research, sometimes failures is accepted, but it is not a certain level of evaluations. What we did, we created a landscape in terms of what are the quality specifications for different critical materials. So, represent what? So, theories like actually helping the companies if I'm comparing it with the bench. This quickly ability important writing its own just action. So why we were not making? Probably that kind of focus and emphasis was not there. We picked up companies who had ability to prepare probes, amidites, phosphoramidites, into the synthesis of price. We had our COE at ICER Pune with Professor Shivatsan, who is of these materials, compared it with the benchmark, synthesized and probes by doing adequate purification. All the advanced technology, depth of analysis to just quality of these. So to hear a lot of scientists who have very nice proof of concept doing that, visualizing what your product is supposed to be. So that is how these kind of evaluations are very so similarly, which was really most low, we probably did with our of the institute. This is cluster where already a COVID testing lab and ICM are approved, so we use startups and quickly evaluate. So not SARS-CoV-2, but also with the variant. So as soon as the Omicron is identified, and because we were collaborating with the campaign for it, and we offered it for validations to the people who were developing the Omicron specific diagnostic kit. ISA Pune, so I think the expertise that they brought, whatever we have achieved. Then these are some of the work that was done by chemistry. It's at IIC Bangalore, and they helped with the process development. So people who had some clones for reverse transcriptase, Cas9 proteins. So we worked across technology. So they quickly developed the process for them because they have the infrastructure expertise. And I must say that all this work was offered without charging for any of it because it was all funded. And the only aspiration was that we become self-reliant. So then we had the quality because a background of having worked in biopharma and then with USP, United States Pharmacopoeia. So that brought the detail, evaluated the quality technology platforms, our lab, CRISPR based. So we magnetic nanoparticle based magnetic beads for extraction. So we did a lot of this kind of work to actually create that momentum. We also had at CCMT, because they again had infrastructure or doing utilize that again for people that we have. So we have 150. Like I said, across plastic brought in across plastic brought in academic technology impact. Companies who brought in these products went down. And so this is from the country. And actually worked with have conceptualized this strategy, and we were the functional team. COVID actually, because during that peak COVID time. So now actually because the program creating a capacity of molecular diagnostic in India, although it was geared towards COVID, but now we want to switch to detailed workshop. Strengthen not only having the right kind of WHO or other global health agencies, because if we 33% on tests, so detect the disease, and then only detect at a much later. Same platform of validation centers. To start with, we are focusing in and around diagnostics developers to have that development, because we are seem to are in industry for diagnostic as well, as we have great success with pharmaceutical and now with biopharmaceutical. So thank you very much. Yeah.
I mean, making the this capacity building that 1 million tests per day thing to achieve actually. So 3 cheers for her. Thank you. Gives us the confidence. Assured of the things for future exigencies. God forbid, but we are.
Another thing, one very quickly, is the surveillance. So now we are going to also surveillance, which started with COVID. So we are partnered for some of the major surveillance efforts which are going on, like, and we are going to support them with new tools, more cost-effective, multi-pathogen tools for surveillance.
Thank you very much.
I didn't take too much time.
Story actually, but then
Thank you so much, ma'am. Now I felicitate Dr. Mitali.
Wait.
Thanks. Thank you. So with that, we conclude this session. And we have very eminent women scientists who spoke about their journeys and how their research is, and very motivating indeed. Thank you very much for your participation in this session.
Thank you so much, ma'am. Neena Kaklash, session of RTBT 2023, and humbly request Chairperson, Department of Biophysics, Dr. Avneet Saini, to kindly come forward with a token of appreciation.
Yes, ma'am. Wait.
Thank you.
Thank you, ma'am. With the ending of this session comes the completion of lectures that extended to us information of varied fields pertaining to biomolecules and therapeutics. However, our multiple ideas and learning that we will take back to our lab. I request everyone to kindly proceed for the and the participants are also requested to collect their certificates from registration desk.
Wow, है ना?
किसके लिए?
अभी वैलिडिटी सेशन होना है ना?
ये थोड़ा नीचे चार यूनिवर्सिटी जी जी 4 लोग बाकी आएंगे तो भाई मेरी बैटरी डाई तो आया था बाद में भेज लोड सर हेलो आप मेरे संपर्क में हो तो सर आप प्लीज कर दीजिए वो जी बता देना सर मेरे को कैमरा ऑफ
And talks were very wide of, some are very specific, some are of a general nature. And I especially like the way the whole program was arranged, especially with, talks which were from the industry or industry-like people who could, actually motivate the students and tell the students what more they could do. That was really nice. And I think I have only positive things to say. Only one thing, which I don't know why I did not say it to you personally, but before I forget, IMTech is next just to, it's just next to us. They have some wonderful scientists. And they also do excellent work, and there's also quite a bit of industry related work. Maybe you could next time, think of inviting.
We had few lectures in the recent past.
So okay, so maybe that is why. So that is what I just thought they could be part of this conference, they would have also added value to it. But otherwise, they and they won't be. And I would like to personally thank especially the students, because without students you cannot do anything. So I think the backbone of this conference, if they were at the front end, you were at the back end, helping them out, organizing everything.
Students are basically feeling part of it.
No, they are part of it, but they have also contributed in this.
Part of the organizing, secretary.
So when you are congratulating them, they have to also be responsible. Okay, thank you.
Thank you, ma'am. Now I request Simmerti from IIT Roper. She is a participant of the conference. So please give her feedback.
Hello everyone. So right now, after such a wonderful feedback from ma'am, I am short of words what to say. So this conference covered a broad perspective, broad area of the research which is going on in different parts of the country. And whenever we are stuck at a problem, my guide always used to say, come out of the lab. And I think these conferences serve a great platform where we can connect, where we can think, where we can open our minds that how we can progress further. So whenever we connect at such a great platform and see such wonderful research going on, it always gives every one of us who is doing research immense pleasure. So when these types of conferences are organized, a wonderful team, hard work, and days and night of, I would say, hard work is required. And I would like to thank the Department of Biophysics to give us the platform for connecting with all of us and arranging so a great function and conference for us. Thank you.
Thank you, Simmerti. When you listen to your own ex-students so beautifully, it gives us satisfaction that yes, our students are really doing good. Thank you. Now I request Sumitra Dey from NIT Durgapur. He's not here. Okay. So the feedback is over now. Now actually we are very privileged to have our guest of honor, Professor Navdeep Goel, Dean Faculty of Science, Punjab University, Chandigarh. Professor Navdeep Goel have been in a leadership role in various sectors ranging from research, administration and teaching. He has more than 34 years of research experience on condensed matter physics, device application of superconductors, semiconductors and magnetic materials. He has expertise in synthesis of thin film techniques. He has numerous publications in reputed journals and supervised many PhD students so far. As an administrator, he has been member of various governing bodies of Punjab University, Chandigarh, like he has been member of Senate, he has been member of Syndicate, member of Board of Finance. So being a member of various governing bodies, he has contributed a lot toward the holistic development of Punjab University. I cordially invite our guest of honor, Professor Navdeep Goel, to please share a few words of wisdom with us.
He has been DSW for 5 years.
Actually, the list was so big.
Professor D.K. Dhawan, Professor Attorney Kaul, Dr. Neil Saini, colleagues. First of all, I would like to congratulate the faculty of Biophysics Department for organizing such an international conference. It is heartening to know that they involved industry for this conference. See, if we talk about the best universities in the world, because what I have learned in my recent visits to some of the best institutes in the world like MIT or Harvard, because if academics they get problems from the industry, try to give them the solutions, then you learn a lot and you are also working for the society. Fortunately, in India, government is trying to develop that system and they are providing lot of funding for industry-academia interface. Punjab University has also got lot of funds. They got funds for Technology Enabling Center. We got funds for RUSA, where university is planning for pre-incubation and incubation centers, where the faculty as well as students can get some initial startup grants so that they can think about being an entrepreneur. And I'm sure that our students have the capability. Only thing is they need to learn about the problems from industry and work with them, and certainly they will do very well. That also I'm saying because of one reason, that if we look at the percentage of Indian inventors in USA, it's close to 13-14%, whereas if we talk about the people of Indian origin in USA, that percentage is quite low. So Indian students are certainly better, but they need to get an opportunity, and now that the government is providing those opportunities, one should grab that and learn to work with industry for the welfare of society. Thank you very much.
Thank you, sir. Now I request our chairperson, Dr. Amir Saini, to please present our guest of honor, a memento as an expression of gratitude for gracing the occasion.
क्यों नेड़े आंदे डर लगदा?
Now it's time to declare Best Oral Presentation and Best Poster Presentation Awards. We will start with Oral Presentation Awards first. We have 3 sessions for oral presentation. In each session, we are giving 2 awards, first and second prize. So we'll start with Oral Presentation Session 1. The first prize goes to Lalit Mohan Vashisht from Department of Toxicology. He is PCS Mayor.
सर रिकॉर्ड में ढल देगा सारा ही आपको पीछे नहीं पड़ेगा थोड़ा प्लीज
Fourth session 2. Oral presentation session 2. There's a joint first prize for Dr. Gayatri and Dr. Ramanpreet Kaur. Second prize, Dr. Shashi Bala, Department of Biophysics. For OP Session 3, first prize goes to Sunidhi Sharma, School of Now poster sessions. Again, we have 3 sessions. For the first session, the first prize goes to poster number 14, Neetu. Second prize, poster number 12, Rizul Gautam. Third prize, poster number 32, Shruti Tomar. For poster session 2, first prize, poster number 60, Arushi Gabas. Second prize, poster number 46, Tanvi Sharma. Parvati Pan. Poster session 3. First prize, poster number 99, Simarjeet Kaur. Second prize is shared by poster number 86, Nivedita Sharma, and poster number 90, Vikasa Dey. Third prize, poster number
Professor Navdeep Goel, Dean Faculty of Science, Punjab University, and guest of honor for this valedictory session. Invited guests, speakers, delegates, participants, and students. It is my privilege to extend a vote of thanks on this occasion. And finally, after these 2 days, we've arrived at this moment where we have to say goodbye and move forward, as Dr. Tanzir said. So the whole idea of organizing this conference was to unify researchers and young scientists and experienced across various disciplines to come together on a common platform and share knowledge and expertise. Such academic agglomerations are a must for the upcoming young researchers and students as they provide them with a plethora of opportunities to explore, brainstorm, and actually think science. Over the last 2 days, we have had a gala academic conjuncture to feast upon. I am sure each one of us in one way or the other might have gained and felt enriched. I, on behalf of the Department of Biophysics and the entire team, extend a hearty vote of thanks to all the speakers for gracing the occasion and sharing with us their findings and opinions. We are also thankful to our university faculty colleagues who enthusiastically participated and even chaired various sessions of the conference. We are also grateful to all participants for showing overwhelming response to the conference call and registering in such large numbers. Last but not the least, I would like to thank my colleagues and office staff from the Department of Biophysics for their relentless and unconditional support throughout. I would be failing in my duty if I am not to thank my students' team. Thank you, everyone. Thank you, everyone, for supporting me throughout and making this conference a success. And I cannot forget the man you mentioned, sir, Dr. Naveen Kaushal, for your support, unconditional, wherever required. Dr. Kaushal and the students were the actual pillars behind all the work that you see. And whatever errors or whatever lacunae were left, that are at my part. Thank you, everyone, and have a nice evening.
Very well.
Now I would request everyone to please stand rise for our national anthem.
Jala jala vitaranga, tava shubha name jage, tava shubha ashish mange, gaye tab jaya gatha, jana gana mangala dayak jaya he bharat bhagya vidhata, jaya he, jaya he.
Thank you everyone.
अच्छा किया सबने सबकी मेहनत हुई है थोड़ा लग रहा है कि सब माफ कर रहे हैं
टिंकू बाजी हेलो सर, प्रोग्राम की समाप्ति होगी। हाँ जी, कर दो बंद होना, बस कैमरा क्लोज कर लगा।